Uh, we have to get the Karnataka into continuous because Vidya Tobi
Every day.
madam and Shobha Gudi finished. So we need more Karnataka people inside.
Jyoti madam, more
Yes.
than Karnataka, she is very dynamic. She deserves that. What?
Oh,
That's
thank
what
you,
we all
Durga.
feel.
Yes.
And it's a real fact. Because her society, Hassan Society, has bagged the best award for consecutive 7-8 years. Such a dynamic person. I'm not telling you in your presence, even your absence, I say.
Yes, Dr. Durga
Deserves
Das, I
it.
know you always.
We totally agree with Durga Das. Bharti?
Yes,
Yes.
Rekha, thank you. No, it's a
Yeah.
lot of work, groundwork,
evening,
and
good-
committee
Yeah,
madam.
that has been going on.
Good-
Thank you.
Good evening,
Individual
good
service
evening,
and
good
not
evening to everyone.
individual front. In the sense, you have collected many people together and done that.
Durga
Our
Das,
present
please.
Avaya. Namaste,
Yes.
Vidya madam.
first things
Yes.
first also,
No.
sir.
Yes, Jyoti madam, just definitely. Yes.
Vidya madam, namaste.
Namaste, namaste, namaste. Great
Madam is
going.
traveling.
Vidya madam
Adhyakshರಿಗೆ
is always
ನಮಸ್ಕಾರ.
traveling. She's always in the car.
No, I'm coming from my college. I'm going home.
Because
Okay,
madam
good,
is
good.
very dynamic always.
So, Vidya madam, tawali coffee, busy, busy coffee ಇದೆ ತಗ್ಲಿ.
ಅಧ್ಯಕ್ಷರಿಗೆ ನಮಸ್ಕಾರ.
Namaskara,
madam.
Dr. Durga Das. Namaskara, namaskara.
Madam is not static.
I think it's 6 o'clock. Yes.
Good evening, Vidya Tobi ma'am. Good evening, Durga.
Namaste,
Yes.
namaste, namaste,
Good
everyone.
evening, Kavita. Good
Namaste,
evening.
madam. Good evening.
Namaste, Kalpana.
Dwarkanath, sir, good evening.
Namaste, madam. Rekha, madam. Namaste.
Good
Good night.
Good evening.
We are now live.
Namaste,
Yes.
namaste.
Good
Yes.
evening,
Yeah, yeah.
Vidya, madam. Namaste.
Namaste, namaste, namaste to everyone.
Sir, ನಿಮಗ್ ಗ್ರೀಟ್ ಮಾಡಿದೆ ನಾನು.
Yes, madam.
We are live.
We are live. I'm sharing my screen. So, very good evening to all respected delegates and faculties who are present over here. I am Nilesh Darji from Corona Remedies. Welcomes you all in this 158th edition of Happy Learning Masterclass webinar series, jointly with Bagalkot, Belgaum, Bijapur, Gulbarga, Mandya, and Tumkur. The theme for today's session is all about MTP. The MOC for today's webinars are Dr. Suman Sinha and Dr. Asha Jain. Let me introduce them. Dr. Suman Sinha, ma'am is President Ranchi of Gynec Society, Senior Consultant at AH IVF and Infertility Center Ranchi, Director Advanced Care and Maternity Center Ranchi, and Madam has also received various awards, and Madam's special interests are in vaginal surgery, high risk pregnancy, and endoscopic surgery. Welcome, ma'am. Our second MOC for today's webinar is Dr. Asha Jain. Madam is Director SMSA Hospital Raipur, Medical Director Cancer Prevention and Relief Society, elected member Chhattisgarh Medical Counseling, Vice President IMA Chhattisgarh, and Madam has 32 years of experience. So I welcome Dr. Asha Jain as well. The coordinator for today's webinars are Dr. B. Kalpana and Dr. Jyoti Banglowala. Dr. B. Kalpana is the course director for postdoctoral fellowship in endogynecology affiliated to MGR Medical University. Madam is national coordinator for Infertility Committee FOXI, chairperson Infertility Committee TNFOG, secretary MOGS. Madam has also very vast academic profile, and Madam has also received various awards like Best Doctor Award by Dr. MGR Medical University, Golden Excellent International Award by European Continental University, Medical Excellent Award 2018 from Governor of Tamil Nadu, Best Medical Service Award from Madurai District Collector. Our second coordinator for webinar is Dr. Jyoti Banglowala. Madam has 26 years of experience. Madam is Vice President Indore Obs and Gynec Society 2022 to present. Secretary Indore Obs and Gynec Society 2021 to 2022. Interested in ethical and medico-legal aspects of OBS and Gynec. Madam has also received various awards from Indore and MP government. And Madam has worked for more than 8 years in various FOXI committee and published many papers and conducted various educational and awareness campaigns and invited as faculty in many national and international conferences. I welcome you, Dr. Jyoti Banglowala.
Thank you.
And as per the traditional course, we are going to start our webinar with a digital lamp lighting session. So let's have it. you all respected doctors. Now I hand over the session to our MOC, Dr. Suman Sinha. Ma'am, over to you.
Can you hear me now, Nilesh?
Sorry?
Can you hear me?
Yes, yes.
Okay. So, a very good evening, everyone. After invoking blessings from our Almighty and seniors, we are going to start the inaugural function. And now, on behalf of Happy Learning team, I take the honor and privilege to welcome all the dignitaries and our esteemed guests on the dais and off the dais. In the 150th episode of Happy Learning Masterclass webinar series in association with Begalkot, Belgaum, Bijapur, Gulbarga, Mandya, Tumkur, OBG societies. The theme of today's webinar is all about MTP. In this webinar, you will have a very unique experience, entirely different from the other webinars which you all have attended. I invite you to relax and enjoy the session. And now I invite our program director, a great visionary, teacher of teachers, a medical legal expert, past Vice President Foxy, Dr. MC Patel, sir, for his official welcome address. Over to you, sir.
Thank you, Suman. It gives me immense pleasure to welcome you all for this 158th episode of Happy Learning Masterclass. And as mentioned, joining society Bagalkot, Belgaum, Bijapur, Gulbarga, Mandya, and Tumkur. I welcome Dr. Nisli Madam from Gulbarga, who have kindly consented to be guest of honor to bless the webinar. I also welcome good old friend Dr. M.B. Billard from Belgaum. He has also kindly consented to be guest of honor to bless the webinar. I also welcome Dr. Vidya Thobi Madam from Vijayanagar. She has also kindly consented to be guest of honor to bless the webinar. And one old good friend, Dr. Durgadas Asrana from Tumkur. I welcome Dr. Durgadas to this August gathering, and you have kindly consented to be guest of honor to bless the webinar. And I still cherish my sweet memory of my visit to Tumkur this year only, and great hospitality and warm welcome from Durgadas ji. I cherish that also. I also welcome learned speaker for today's webinar, Dr. Usha Dudamani Madam from Gulbarga, and she has kindly consented to deliver talk for as far as clinical aspect of MTP is concerned. I also welcome three learned chairpersons who have kindly consented to chair this respective session. Dr. Rasri Paladi from Gulbarga, Dr. Asalata Mallapur Madam from Bagalkot, and Dr. Dwarkanath from Tumkur. And luckily, I have visited all these societies. Gulbarga long back in 2013, I have visited physically, and at that time, Rasi was secretary. Asalata Madam, I still remember my recent visit of Bagalkot in this year only, and cherish your warm welcome and hospitality extended to us. So welcome, Asalata Madam. And Dwarkadas ji, again from Tumkur, I welcome you all. I also welcome all the learned panelists, because today this is reverse panel. Panelists are going to ask questions, and being a moderator, I am going to answer all the questions. Nagaratna Kuntoji Madam from Bagalkot, again just I mentioned. Dr. Sobha Syavi Madam from Bagalkot, I just mentioned about my recent visit of Bagalkot, and warm welcome and hospitality extended by all of them. Dr. Sumaya Firdos Patel Madam from Belgaum, Dr. Sweta Patil Madam from Belgaum, Dr. Subhas Mudnur Sir, Bijapur. I still cherish my sweet remembers during my visit to Bijapur. I visited Dr. Subhas Sir's home for lavish breakfast. I also welcome Dr. Rasri Eliwal Madam from Bijapur, Dr. Mahananda Madam from Gulbarga, Dr. Anita Gora from Gulbarga, Arjun Kumar from Mandya. I still cherish my recent visit of Mandya, and they all were very caring person. So welcome, Dr. Arjun. I also welcome Dr. Jyothi Siddha Lingeshwar, President of Tumkur Society. I also welcome Sailat Madam from Tumkur. I also welcome Pooja Margol from Gulbarga, Sanjana Tallur Madam from Gulbarga, Jayshree Madam from Gulbarga, Uma Madam from Mandya, Indra Vivek Madam from Tumkur, Manpreet from Bijapur. Again, I cherish my sweet memories of my visit at Bijapur when Manpreet had a warm welcome and hospitality. Welcome, Manpreet. I also welcome Dr. Kavita Barnwal from Bhagalpur. I also welcome Dr. Jyoti Mahesh Madam from Tumkur, and of course, Bharti Rajshekhar from Hassan. And Rajendra Kumar has coordinated this webinar. I also welcome Dr. B. Kalpana from Madurai and Dr. Jyoti Banglowala from Indore. Both are since long in this series as a coordinator. I welcome both of them. And this year, B. Kalpana is contesting for post of infertility committee, and Dr. Banglowala is contesting for ethics and medical legal committee, FOXY. And I appeal all the president and secretary who has joined this webinar to support their candidature. I also appeal to support Dr. Bharti Rajshekhar. She is going for NCD committee this year. I also welcome Dr. Asha Jain Madam from Raipur and Dr. Suman Sinha from Ranchi. Both are in this series since long as a master of ceremony. Suman Sinha is contesting for post of vaginal surgery. So I appeal all the president and secretary to support her candidature. Also, Dr. Kavita Barnwal is also contesting for urogynec committee. So all the contestant rather, they are deserving person working hard since long in FOXY. So all the president and secretary are requested to endorse their candidature and support them. So in this era of COVID-19 where physical meetings were not possible, we started this series. And when I started, I invited 3 more friends, and with 4 people we started. And now it is 158th episode of Happy Learning Masterclass. And with this, we have extended family of Happy Learning Masterclass 7,000 plus. And it is very happy moment to share with all of you. So with this seminar, we have little change in our module. Only 1 lecture related to clinical aspect of MTP and reverse panel about MTP Act. So all the learned panelists put their question, and being a moderator, I will be answering the question. And at the end, whoever delegates have joined, they will also be allowed to ask the question if time permits, and they can put their question in chat box also. So with this brief introduction about today's webinar, I welcome you all and all the president and secretary of joining society, that is Bagalkot, Belgaum, Bijapur, Gulbarga, Mandya, and Tumkur, and all the delegates who have joined this webinar. Thank you very much.
Thank you, sir, for your very precious words and the welcome address. And can I have the CV of Dr. Bharti Rajshekhar? Nilesh ji? Mr. Nilesh, yeah. As we all know, Dr. Bharti Rajshekhar is the convener of today's webinar, and she is the medical director and OB-GYN consultant at Vatsalya Hospital, Hassan. She is also the Honorary Secretary General of Kasoga, and she is the Vice President of KPMEA State. She is the Director of Indian Red Cross, Hassan. She is also the Vice President of IMA Karnataka State. She has been the past President and Secretary of Hassan OB-GYN Society, and presently she is a committee member of PCPNDT Act of Hassan. She has been the FOXY Food Medical Equipment and Drug Committee member, recipient of Rajya Sabha Award for her work in healthcare in Hassan, and she has also been invited as a faculty in various state and national conferences, and she is actively involved in adolescent health awareness activities. So Dr. Bharti Rajshekhar, I invite you and welcome you, and kindly introduce our guest of honor, Dr. Gangambika M. Nisti, Madam.
Thank you, Dr. Suman, for that wonderful introduction. And at the outset, I would my pranams to Dr. M.C. Patel, sir, who has been so inspiring to all of us and encouraging us all to work towards the betterment of women's health. And I thank all my dear Kasogians for giving me this opportunity to be here today. And so without wasting much time, I request Dr. Gangamika Madam, who is a very senior consultant from Karnataka. Madam has finished her MBBS in 1981 from the Dharwad University, and she has completed her post-graduation. She is a retired professor and HOD of the MR Medical College, Gulbarga, and also at the Basveshwar Teaching and General Hospital, Gulbarga, and Sangameshwar Hospital, Gulbarga. Madam is the director of Basvalingappa. There's some echo coming.
Bharti, you must be logged in from 2 actually.
No, I haven't logged in. It's only one device. Activities, Madam, till 1983 till date, she's a life member of the Gulbarga OBGYN Society. Year 1984 to date, she has attended many national and state conferences. In 85, she joined as a lecturer OBG department of MR Medical College OBG. She's trained in USG in ultrasound at Mediscan Chennai under Dr. Suresh, trained in ultrasound at Apollo Hospital under Dr. Arkad Gajaraj from Apollo Hospital, Chennai, and trained in ART procedures at Jaslok Hospital, Mumbai, Sion Hospital under Dr. Firoza Parikh, Dr. Rubin Shah, and Sudesh Kamath. Madam has trained in ART in Apollo Hospital, Chennai, trained in laparoscopic surgeries from Bangalore by Dr. B. Ramesh, and she's conducted numerous adolescent, antenatal, menopause, infertility health camps at Basveshwara Teaching Hospital and General Hospital, Gulbarga. And Madam is a familiar face in all our academic programs, and her enthusiasm to join and learn is infectious. I welcome you, Madam, to this August webinar. Gangapika, Madam.
Is she there? Has she joined? Or we may proceed accordingly, and when she joins,
Yes.
blessing
Yes, sir.
at that time.
Yes, sir. Yes, sir.
And anybody who is free, have a phone call to Madam.
Rajeshri, can you please call Madam?
Ma'am, I'll just call and I'll just
Yeah,
come
please,
back.
Anika. Yeah, please.
I'll do
We
that.
can continue.
We can proceed accordingly.
Yes, sir.
Yes,
we can
ma'am. I'll
continue.
just
do that.
Oh, yes.
Dr.
I'll
Asha,
call
you can go
to
ahead.
Madam.
Yeah. I think we can go on with the program.
Yes, madam.
Yes.
So,
Suman, we can proceed accordingly.
can
When
go-
Madam joins, we will have blessings.
Vidya madam was here, no? Dr.
yeah,
Vidya.
Vidya Madam is there.
Hato?
She was there. She had joined.
Yeah,
Dr.
civil
Vidya
address.
Madam.
Vidya madam was here only. She said, I will just say.
No
bless.
issue. Dr.
No, we can
Billard is
introduce Dr.
there.
Bellat sir is there.
Billard is
Bellat
there.
sir is
Dr.
there.
Durgadasi is
Dr.
there.
Durgadas is there.
So we can proceed accordingly. And when Vidya and Nisti Madam join,
Uh-huh.
we will have blessings
So,
at that
so
time.
I'll take the honor to introduce Dr. Rekha Rajendra Kumar. Can I have Madam CV?
Yes, ma'am.
Yeah, and then I will request her to introduce Dr. Bellat sir. So, Dr. Rekha Rajendra Kumar is the convener for our today's webinar. And she is a practicing gynecologist for last 31 years, very active member of our Foxy Society. She has been elected as Bangalore Society, President Bangalore Obstetric and Gynec Society. And she's been invited faculty in more than 700 state, national, international conferences. She was also South Zone Coordinator in the Foxy Infertility Committee. And she's an infertility expert as well. She is recipient of 15 awards, 5 felicitations, including 1 international and 3 state awards. She is ex-PG teacher of MS Ramaiah Medical College and Bangalore Baptist Hospital. She has her own 16 articles and 1 case report, 1 poster presentation in ASRE Conference 2021. And she has contributed more than 100 radio and television talks, 40 newspaper articles, all on women's health. And presently, she is medical director of Miracle IVF Hospital and Chandana Hospital at Bangalore. Welcome, Dr. Rekha Rajendra Kumar. And I request you kindly to introduce our guest of honor, Dr. M.B. Bellat, sir.
Thank you, Dr. Suman, for introducing me so well. And it's my proud privilege to introduce Sir Dr. M.C. Bellet. Sir is a very familiar figure, not only in Karnataka, as well as national and international faculty. Sir has presented many papers at the international level too. He is the professor in the Department of Obstetrics and Gynecology, JN Medical College, senior consultant, KLE's Dr. P.K. Hospital, Belgaum. Sir was also the president of Kasoga from 18 to 19, Secretary General of Kasoga from 2012 to 13. Sir has fellowship in perinatology, University of Illinois, Chicago in USA 2000, and Global Network Scholar 2004 to 7. He is the principal investigator for international trials, important topics and aspects of maternal health like preterm labor, cradle trial, etc. He's also received Teacher of Teachers Award. That's a very great thing, a great accomplishment. And other than that, he has certain other feathers on his cap, like Best Scientist Award 2013 to 14, Best Teacher Award 2010 to 11, a lot many things. Over to you, sir. We would like to hear from you, Dr. M.B. Bellet.
Yeah, good evening, friends, and thank you, Dr. Rekha, for that elaborate introduction. Actually, I must congratulate Dr. M.C. Patel, sir, who has taken so much enormous efforts to continue and look at his the aptitude, and that determines, your altitude. Because see, 158, no less, so series of events. At least in a few, I was a faculty or even as a moderator. Sir, thank you for that enormous encouragement and support, and in bringing up the young talent, which is very, very important. See, the legacy of learning must carry on, skills go on. So because we need to pass on to our younger generation. In this regard, these really webinars are of great help. And, COVID brought up a new area to associate ourselves. And this MTP, I just want to convey that all the delegates who are here today, see, this is a very, very important topic. No amount of, the reading may not get this information, what the experts are going to share with you today. And, what are the prerequisites, how we should go about. I just want to quote day for yesterday's one incident. One girl who came, she is unmarried, but she is an adult. She is working as a maid in one of the homes. And she had an affair with one of their relative and whom she wanted to get married. So she was brought to because she was pregnant, and she asked us that, hello, can you hear me?
Yes, sir. Carry on, please.
Yeah, see, this patient, she came to me, and the relatives asked me whether I should be performing this. Even if simple medication you can give and do this. I said, nothing like that. See, we need the authenticated relative. She can give a consent. Suppose, however simple the procedures may end up in problems. At that time, whom we should be informing? So who should be authorized attendant, or who is a legal person? So these all are important. So she came with the next day with her mother officially, and accordingly all the criteria were met. Though she was an adult, we need to follow certain guidelines. And this is very, very important. And that is why today's webinar is going to enlighten us. And Dr. M.C. Patel being the legal expert, medical legal expert, with his guidance, I think we all are going to learn a lot. So, sir, congratulations once again. And all my co-chairpersons, Dr. Gangambika, Dr. Durgadas, and my conveners, the Bharti and Rekha, for introducing us, and also all the panelists, speakers, that you have taken a lot of efforts, because every time when we come on this to give the academic information, we need to learn ourselves first. And when we learn ourselves, we can give it in a best way. So what is the best way to learn is teach teaching. So this is what it makes us experts. So with that, I congratulate once again and request to proceed with the academic things. Thank you so much. Thank you once again.
Thank you. Thank you very much, Dr. Billard. Of course, you are always with me in any of my academic activities. And you have very nicely mentioned one situation or case rather. And we are going to discuss that very case during our panel discussion also. So thank you.
Bellad, sir. Over to Suman.
Inspiring words. And now I take the opportunity to invite and welcome our guest of honor, Dr. Madam. So can I have Madam CV? Yeah. So, as we all know, Dr. Bidya Thobi Madam, she's such a kind human being and she actually needs no introduction. But as a customary, I'm going to do so. Madam is the president of Kasoga Obstetric and Gynec Society for year 2023 to 2024. She is also the professor and head department of obstetrics and gynecological gynae in the Al-Amin Medical College of Bijapur. She has been the very active chairperson of Food, Drug and Medical Surgical Equipment Committee of FOGSI between the year 2018 to 2020. She has received the Best Committee FOGSI Award and also award Dr. Mehru Dara Hansoti Award in 2020. She is also the present ICOG Governing Council member. And she has been the FOGSI champion. She is the recipient of FOGSI Champion Award of 2019. She is also the national corresponding editor of Jogi, the famous journal Jogi. We all read it. She was the organizing chairperson of Kasoga 2016, president of Bijapur OB-GYN Society in 2009. She also served as secretary Bijapur OB-GYN Society 2007. And she has numerous publications in various books and contributions and has done many contributions to FOGSI. She is a focus speaker in many national and international conferences and has presented papers at national and international conferences and has the credit to organize various CME workshops and many awareness programs. She is also she is in the advisory faculty of boards of the Rajiv Gandhi University of Health Sciences, and she is the postgraduate and undergraduate teacher for more than 30 years. So welcome, Dr. Bidya Thobi Madam, and we are eager to hear your precious words.
Thank you very much, Dr. Suman, for those kind words, and I am extremely thankful to Dr. MC Patel, who is doing this Happy Learning Master Class webinar series since so many years. And I am very thankful that I got the opportunity to work under Dr. MC Patel. He was my vice president and he has guided me in many of my projects so that I could get the Best Committee Award. He has brought many galaxy of speakers here, and I think galaxy of contestants also. So I wish now already the voting has started and we are motivating the voters to vote for all of you. So I feel that from bottom of my heart, all are my friends. So beyond the friendship, they are there. We wish them all the best for their whatever in future in FOGSI. Another thing is this topic all about MTP is evergreen topic, I must say, as Dr. Bellad was pointing out about some case. Every city, every district, even though the newer amendments so many times we are talking about, every time there is a question mark, every time the police and the other people, so they have so many questions. And Dr. MC Patel has also consented for our free helpline at for Kasoga. So his number will be uploaded now. Our website is getting renovated. So his number will be uploaded at our website. Anybody has got question, anything, anytime he has kindly consented to give his advice free. So his number will be uploaded, his email will be uploaded. Any of your problems you can ask him. And here also so many panelists, I think there are 10-15 panelists, they will be asking question to Dr. MC Patel sir. That is reverse panel. This is very novel idea that any moderator, the panelists will be asking a moderator. So this is very nice idea also, and we can ask any questions also. Even the delegates who have joined here, they can also ask the questions. So it is a topi and reverse panel. So thank you very much once again. I will be also listening to all the questions and answers, and I may also put some questions
Yes,
to
welcome.
Dr. MC Patel.
Welcome, welcome.
So thank you very much. I will not take much time. So because so many things are to be discussed. So all the best for all the speakers, all the contestants, and thank you all the delegates, because it is a Kasoga, my Kasoga, and so many Kasogas district and their president secretaries have joined this webinar. Thank you very much and all the best, sir. Thank you.
Thank you, madam.
Thank you, Vidya,
your
for sparing time.
blessings and support.
Yes, this is our fourth round with Kasoga, because already we have
Yes.
completed 3 rounds of all over India, and Kasoga we included all the 3 times. Now this is fourth round with this 6th society, and in due course we are going to do the same type of webinar in other society of Kasoga also, with different.
Yeah, I can see Dr. Kavita Barnal, Dr. Kalpana, Dr.
Yes.
Suman Sinha, Dr. Jyoti Banglowala, our own Bharti,
Thank
and
you.
so many others they have joined. Even Dr. Sneha has joined here.
Yes,
I can
yes.
see her.
Welcome,
So
welcome.
she is there.
Yes.
So
Thank you,
welcome
madam.
all.
Thank you very much.
Yeah.
Thank you very much, ma'am. Thank you.
Vidya
Okay.
madam, not only your questions, your inputs are also welcome in the
Yes.
reverse panel.
We will, Rekha,
Definitely.
Rekha, we will invite Vidya to have her inputs and comments at the
Yes,
end.
sir. Yes, sir. We don't
Okay.
want her to leave now, so we told.
Yes, yes,
No, we are not. I am not leaving. This is very interesting panel.
yes,
Okay, madam.
Yes,
Okay.
Yes.
Fine, fine.
yes.
Thank you, Vidya madam, for your pearls of wisdom, and thank you, Patel sir, for your valuable comments. And now I take the privilege to invite and welcome our next guest of honor, Dr. Durga Das Arsana sir. Rana sir, yeah. So, sir is working in Kasturba Hospital at Tumkur. He is the treasurer of Kasoga for the year 2020 to 2022, and has been the past executive committee member of Kasoga between the year 2018 to 2020. He has also been the past president of Tumkur Society of Obstetricians and Gynecologists. He is presently the associate professor in Sri Siddhartha Medical College of Tumkur, and also a very dynamic consultant in Kasturba Hospital, Tumkur. So welcome, sir. We are eager to hear your precious words. And we are also willing to come to Tumkur to have a very yummy breakfast, I can say. Thank you, sir.
Thank you, everybody. Good evening, sir. Good evening,
Good
everybody.
evening.
At the outset, I want to congratulate Dr. Patel, MC Patel, sir, for your marathon run of 158 innings. It's a real big congratulations I have to shower on you. Before telling anything, I want to tell 2 lines about the simplicity of MC Patel, sir. Incidents which I remember just 6 to 8 months back in Government Hospital of Tumkur, there was a medical legal incident, and the doctor was about to get arrested. Immediately, I called Patel, sir. He was in Punjab attending in a conference hall. He came out of the hall, received my call, and I explained the events, and he was so kind enough to guide me in every step. And we are lucky the doctor was not arrested, and everything went on very smoothly. So that is the simplicity of Patel, sir.
Thank you.
So thank you once again, sir. I will never forget this. Number one. Second thing, as Bella told, I want to quote one incident. A few days back, there was a couple, 17-year-old girl has come to my chamber with the parents for MTP. It was a legal marriage. Everything was fine. They came for MTP. because it was unwanted pregnancy. See, we have to keep it in mind whenever the pregnancy occurs within 18 years, even if it is a legal marriage, it should be passed through the POSCO Act. Sir is going to throw light on this regard. So I want to add this event which struck me while Ballad was narrating. So I wish all the best to this event. Before closing up, I have to say good wishes to my own Dr. Bharti Rajshekhar, Dr. Kalpana, Dr. Suman Sinha, and Dr. Jyoti Banglawala. Our heartfelt wishes.
Madam, Dr. Kavita Banwar also.
And Kavita. Yes. Our heartfelt wishes to all of you. I hope you all come with flying colors. Thank you. Thank you, sir.
Thank you, Dr. Durgadas. Incidents you just mentioned. It is always my pleasure to be helpful to any of our Foxian friends. During my journey in a service of Foxy, I have visited smaller society and I am in touch of very common Foxian friends. And whenever they call me at even middle of the night, I am always there to assist them because I know whenever they call me at odd hours, naturally they will be in some trouble.
Right.
Just say hello. Nobody will have a phone call at 2 a.m. or so. So
Yes, sir.
I listen them very carefully. I guide them accordingly. And it is my pleasure that in that very incident just you mentioned, doctors were not arrested due to proper legal steps which we advise and you followed. So it is my pleasure. And still I remember my visit of Tumkur in this year only, and warm welcome and hospitality from you all people from Tumkur. Thank you very much, sir.
Thank you, sir.
Thank you, Durgadas Rana sir, for wishing us so good, sir. We are really feeling blessed.
Durgadas sir, so genuine officer.
Yes, sir. Genuinely, he can. Really, we're really happy and thankful to you, sir, for taking up this.
Yes. Now straightway to
the academic.
Yes.
Yeah. So without wasting time, we are moving first to the academic session. And for this, I hand over to Dr. Kumar for further proceeding. So over to you.
Thank you, Dr. Suman. Now we are into the academic session. The academic session basically has two parts. That is, part one is a talk followed by a reverse panel discussion, as Dr. Sir MC Patel sir told. The first is a talk on all about MTP, and speaker is Dr. Usha Dodmani. To invite Dr. Usha, I have three chairpersons who are gracing the occasion and chairing the session: Dr. Rajashri Palladi, Dr. Ashlata Malapur, and Dr. Dwarkanath, all my close friends. Mr. Nilesh, if you don't mind, can I have the CV of Dr. Rajashri Palladi displayed? Yeah, the brief introduction of Dr. Rajashri. She is the Honorable Secretary of Karnataka State Obstetrics Gynec Association, that is KASOGA. She is the present secretary. She is Dean of Research of KBN University, member of IQAC. She is the member Academic Council of KBN University, professor in the Department of Obstetrics and Gynecology in Kalaburgi Medical College. She's UG and PG teacher, lot of papers and guest lectures to her credit. Also, she's the past president of Gulbarga OBG Society. The next, I invite Dr. Ashlata, Dr. Rajashri. Once I introduce all three of you, I will request you to speak few words on the topic, and Dr. Ashlata to talk about the speaker, and Dr. Dwarkanath to give the concluding take-home messages. I'll just introduce the three chairpersons, if you don't mind. Dr. Ashlata Malapur Madam is the MD DGO from MR Medical College, Gulbarga, Karnataka. She's presently working in SN Medical College and Research Center and Hanagal Kumareshwar Hospital, Bagalkot, as professor and HOD in the Department of Obstetrics Gynec. She has 3 decades of teaching experience. She has solid experience in academics as well as research, especially the community-based trials and clinical trials, and has many publications to her credit. Welcome, Dr. Ashlata Madam. Dr. Dwarkanath Sir is a professor of obstetrics gynecology in Professor HOD of Siddhartha Medical College, Tumkur, MS OBG from Ballari. He is a president of previous past president of Tumkur Society of Obstetrics Gynecology in 2022. Sir is a UG and PG teacher at various universities of India. Several national and international publications he has. He's also the judge for scientific papers at many of the conferences, and his areas of interest are high-risk pregnancy, infertility, as well as gynec endoscopy. Over to you, chairpersons.
Yeah. Pranamams. Good evening to all the respected members present here on this wonderful occasion. And my due regards, respects, honors, and credibility to Dr. MC Patel, sir, who has been tirelessly working to get us all together on multiple forums. And I just cannot describe his commitment that night 11:30 or 12, he just texts that, can you suggest some faculty for so-and-so? And that is his incredible amount of dedication to the spread of academic work and the medical legal aspects of our fraternity. It is beyond any kind of comprehension for anybody that each one of us would like to be safe in our practice and sleep safe. And that is the amount of knowledge that we get to share from each of the sessions of Dr. MC Patel, sir. And thank you so much, sir, for having me in each of your sessions in Kasoga. It is indeed an honor. And it is in 2011 that you had visited to Gulbarga, and when I was the secretary, and we really enjoyed. From then on, our eye-opening or aspect or knowing about the medical legal aspects started, because until then there was no organized or systematic channelized lectures on this topics of medical legal aspects. I also had a similar incident like Dr. Durgadas sir has mentioned, and I can vouch for his amount of dedication to help the fellow colleagues in any such given scenario. And as mentioned, MTP continues to be there as a prevalent issue as long as there are fertility issues, as long as there is a concept of thing going on. And each time whenever we land up in some problem is when we click in our mind that yes, we should have known more about this safety aspects or measures. Apart from knowing the clinical safety issue and technical safety issue, there are issues way beyond our control, because when law comes in and brings forth the various challenges is when our wits are extended to the maximum. And thank you very much, sir, for getting us together to bring in such wonderful topic. And I wish Dr. Usha best luck to do her presentation. And she has been involved in MTP related issues, being in the government medical college. And I extend my heartiest best wishes to all the contestants who are here today on this forum. And I'm sure you'll all make it a big success, and wishing you great luck, Dr. Bharti ma'am, Dr. Jyoti, Dr. Suman Sinha, and all those who are contesting for the post of chairman. And thank you again for giving me this opportunity.
Thank you, Dr. Rajeshri, for your words on the topic as well as gracing the occasion. Over to Dr. Ashalata Malapur, madam, for few words as well as introduction on the topic. Ashalata, madam.
Hello, madam. Good evening.
Yes,
Good evening,
welcome, madam.
everybody. Really, it will be a wonderful session today because it is a need of an hour. Everyone has to know detail about MTPs. And when Dr. MC Patel just came to Bagalkot recently on medical legal conference, he told us that if you want to have a nice, good sleep, keep my number under your pillow. So he's always helpful, and I think we will not waste much of our time. It is very interesting topic, so we will go ahead. I would like to introduce my very close friend, Dr. Usha Dudmani. So Dr. Usha Dudmani, she is professor and head, Department of OBG in Gulbarga Institute of Medical College, Gulbarga, UG and PG teacher and examiner. She is an NMC assessor. Publications, she has many publications in national and international journals. Past vice president of FOXI Kalburgi, master trainer and coordinator for comprehensive abortion care Kalburgi. She is a master trainer for BEMOC and maternal death review committee member. So All the best. Over to you, Usha.
Thank you, ma'am. Thanks a lot. Good evening to all the dignitaries of this webinar. I thank Dr. MC Patel, sir, for having given me the opportunity to talk on the clinical aspects of MTP. And I would like to thank Rashi Paladi, madam, for suggesting my name for this topic. And I'm very grateful that my teacher, Dr. Ashlata Malapur, ma'am, has introduced me for this webinar since I have worked with madam for almost 8 years. I'm very thankful to have been a part of this webinar, sir. Thank you. Thank you to all of you. Now, I would like to talk on medical termination of pregnancy, which is very important topic, and we come across many such cases in the government institution since I come from a government institution. Now, I would like to, many of you have shared your stories. I would like to share one of the small story, and to begin with this story, I would like to tell. Meena got married at the age of 16 and had 3 children in quick succession, leaving her very weak. Her husband Bola worked as a laborer. Meena conceived once again and felt very weak. One day she wanted to share her experience with a friend, so she was told that she wanted to terminate her pregnancy with the help of the village Dai. When Meena spoke to her husband rebuked, saying that it is against our social this thing, and women who have affairs outside marriage seek such services. On instance, Bola permitted her to meet the Dai. He borrowed some amount of money and asked Meena to visit the Dai. In fact, they took her to the Dai, and it was a few hours job. After the procedure, she looked very pale and barely was able to walk. At home, she was having constant bleeding and abdominal pain. Meena's condition gradually deteriorated as she had high-grade fever. Her breathing became irregular and she became unconscious. So the aim of this story is many of the MTPs that have been undergone or patients are undergoing MTP belong to this category. Then they are very poor, or they cannot share the whatever the problems they have with the public, neither with the husband, nor the husband is supportive for this. So there are many factors that come in the way for people like Meena to approach the medical services that is under the MTP. Now, what are the factors influencing the abortion services? So there are 4 factors that come in the way of the woman seeking for MTP services. That is the social factors, economic factors, physical and policy makers. Now, the social factors are what, according to the study, according to the story, it is the lack of awareness that abortion is legal, and it is a social stigma, gender discrimination and low status of the woman, lack of male responsibility, and women do not go to the male providers. So these are some of the social factors, and the policy factors are legal aspects of abortion not disseminated, and very few qualified persons are available at the point of care, and inadequate equipment and supplies by the public hospitals, and low use of contraceptives and weak referral linkages. And there are economic factors because of the poverty, and private providers charge high fee, and the physical access are the few trained providers are available at the area. So these are the factors that interfere with the woman seeking for the MTP services. Now, what is the abortion scenario in India? Abortion accounts for almost 8% of maternal mortality ratio, though it varies from state to state. And as you all know that maternal mortality rate is 103 per 1 lakh live births. Unsafe abortions lead to complications such as sepsis and bleeding, and may lead to chronic debilitating disease also. While India was one of the first countries to legislate a law to ensure safe abortion for women 4 decades ago, unsafe abortions still account for significant maternal morbidity and mortality in India. So as you all know that MTP Act was enacted in India in 1971. I'm not going into detail of this act, and this act allows termination of pregnancy up to 20 weeks according to 1971 Act. And it also offers a protection to a practitioner who adheres to the Act and who fulfill all the requirements of the Act. The MTP Act was amended in 2002 and again in 2021. The indications, the 4 indications, most of us know that the continuation of pregnancy is a risk to the life of a pregnant woman or can cause grave injury to her physical or mental health, and substantial risk that the child may be born with the physical or mental abnormalities, and the pregnancy was caused by rape, or it may be due to the failure of contraception used by a woman or her partner. So this was limited to the married woman, and sex selection was not a criteria under this Act. MTP Amendment Act 2002. There are certain features that were amended in the Act of 2002. Lunatic was replaced by mentally ill person. The power of center recognition was devolved into the district level committees. That is, the approval of the facilities providing the MTP services was given to the district level committee, who is to inspect and give the registration certificate to the public sector, to the private sectors. And the concept of punishment was introduced under this Act, or under the Amendment Act of 2002, with imprisonment for not less than 2 years and extending to 7 years. Registration of facilities for first trimester MTP was segregated from the second trimester abortions, and early medication abortions were made feasible and acceptable by the prescription by the registered medical practitioner. So these were under the MTP Amendment of 2002. And according to the 2021, which was amended in September 2021, the following changes were made. That is, increasing the upper gestational limit from 20 to 24 weeks for special categories of women, and pregnancy termination anytime during pregnancy in case of substantial fetal abnormalities, provided it is being approved by the medical board. And failure of contraception. Here, the failure of contraception, it includes both unmarried as well as the married. Previously in 1971 Act, it was limited only to the married couple, whereas this Act in 2021 has extended it to the unmarried woman also. And opinion of one RMP. So for termination of pregnancy, up to 20 weeks, one RMP is required, and for termination of pregnancy between 20 to 24 weeks, opinion of 2 RMPs is required. Previously, it was 1 RMP for up to 12 weeks, and 12 to 20 weeks, it was 2 was required. To make it easier, or to make the abortion services available to all the women, they have made this opinion of up to 20 weeks to 1 RMP. Now, there are special categories that have been included in the 20 to 24 weeks medical termination of pregnancy. Not all cases come under this 20 to 24 weeks period. These are some of the special categories where MTP can be advised for the woman between 20 to 24. That is, the survivors of sexual assault or rape or incest, and the minors less than 18-year-old, the change of marital status during the ongoing pregnancy. It may be a widowhood and a divorce, and a woman with physical disabilities. This disability has to be proved by the person under the Act of Disabilities Act. And mentally ill woman, including the mental retardation, the fetal malformation that has substantial risk of being incompatible with life, is also included under this Act, up to 24 weeks of gestation. And women with pregnancy in humanitarian settings, or in case of disaster or emergency situation, as declared by the government. So these are the special categories where the MTP can be offered beyond 20 weeks of gestation, but it should be less than or equal to 24 weeks of gestation. Now, the consent for any procedure, consent is very important. And as for the legal issues, for women more than 18 years, whether married or unmarried, only the consent of the woman is required to terminate the pregnancy. In case of a minor, that is less than 18 years, or a mentally ill person, the consent of a guardian is required. The guardian doesn't mean the parents. It can be any person or caretaker willing to be responsible for the woman. The spouse consent is not mandatory under this act. Now, who can terminate a pregnancy? These are the same as in case as it was enacted in 1971. There's not much change in the person who can terminate a pregnancy. And for training of the medical methods only, that is medical methods of abortion, the experience at any hospital for a period of not less than 3 months in the practice of obstetrics and gynecology, or has independently performed 10 cases of pregnancy termination by medical methods of abortion under the supervision of a registered medical practitioner in a hospital established or maintained or a training institution approved for this purpose by the government. So most of the training persons required for providing the MTP services are same as it was enacted in 1971. But in case of MMA only, these are the two that is required for providing the MMA services. Now the site for pregnancy, of course, the government hospital does not require any registration. The private sectors, previously the private sectors would take the registration of the hospital, but separate for the MTP was not taken. But now the private sectors require the registration separately for the MTP. This MTP site approval, the public sector do not need separate approval. All private sites need approval before starting the abortion services, and this approval is provided by the district level committee. The district level committee consists of the DHO and 2 or 3 more persons. Among this, 1 member shall be a gynecologist, surgeon, or an anesthetist. Other members can be from an NGO or from a Panchayat Raj institution, or it can be a local medical profession. At least 1 member should be a woman of this committee, and the tenure of the committee will be for 2 years. For medical methods of abortion, the site eligibility. This is a separate for medical methods of abortion who have got an OPD clinics. They can have the registration of this, that is the medical method of abortion, up to 9 weeks can be provided by an RMP under the MTP Act from an OPD clinic with an established linkage to an approved site. If a person is having an OPD clinic and he wants to provide services of MMA up to 9 weeks, they have to take the approval from the district level committee, or the registration is necessary, provided they should have a referral linkage to a approved site where if any complication occurs, they can refer the patient and do the services. And that certificate has to be displayed at the OPD clinic. Now, pregnancy termination for congenital malformations. Most of us will come across this because nowadays, some of the anomalies have been detected beyond 20 weeks also. So, this for termination of the congenital malformations up to 20 to 24 weeks, it has been extended by the Act of 2021. But beyond 24 weeks, we encounter certain anomalies which are incompatible with life. In such situations, the medical board will come into the picture. This congenital malformations has to be approved by the medical board. The medical board consists of the gynecologist, pediatrician, and a radiologist or a sonologist, and others as notified by the state or the union territory government. Now, the powers of the medical board to allow or deny termination of pregnancy beyond 24 weeks of gestation period only after due consideration and ensuring that the procedure would be safe for the woman at that gestation age, and whether the fetal malformation has the substantial risk of being incompatible with life, or if the child is born, it may suffer from physical or mental abnormalities. So it can be terminated beyond 24 weeks. A fetus with congenital anomalies beyond 24 weeks can be terminated provided the medical board gives an opinion regarding the termination of pregnancy. Other specialists can also come into the picture in the medical board as the case may be required. So previously, the medical board, the court order was much necessary to terminate the pregnancy beyond 24 weeks of gestation. Now, the government of India, with the comprehensive abortion care guidelines, they have made it easier with the formation of the medical boards. Each district has to form a medical board comprising the gynecologist, radiologist, and a pediatrician, and other specialists as the case may be required. So this medical board will give an opinion regarding the fetal abnormalities and whether it can be terminated or not. Once the medical board gives an opinion, then the doctors can go ahead with the termination of the pregnancy. So this is the report by the medical board. It is called as Form D, and the report has to be given in this. This is being designed or approved by the government of India. Under this format, the opinion of the medical board has to be submitted. Now, mandatory documentations. So all of us should be aware of the documentation that is necessary to protect us from medical legal issues. So we follow all these compulsorily in our government institutions. And I request all of you to go through these documents, that is the mandatory documentation, which is very much necessary to protect ourselves if any case to protect ourselves from the medical legal issues. That is the Form C. Form C is nothing but a consent form. The consent has to be taken here. Here it has got two headings. One is more than 18 years and less than 18 years. So if the patient belongs to less than 18 years, the signature of the guardian is also present. So the Form C consent form is very much necessary before performing any MTP procedure. Now the Form 1, RMP opinion form. RMP shall certify this form within 3 hours from the termination of pregnancy. So this has to be certified by the RMP. And Form 2, it is the head of the hospital. It is also called as the monthly format. It is the head of the hospital or the owner of the place shall send a monthly statement of cases to the DHO of the district or the CMO of the district. And Form 3 is the admission register. This admission register is an approved, it is maintained by an approved site, and all the case details are entered in this admission register regarding the weeks of gestation, the method of what method has been advised or what method has been done, and even the contraception also is included under this register that is called as the admission register. And it has to be kept for a period of 5 years from the date of the last entry. So this register is very important to be maintained. For at least 5 years, it has to be maintained. This is the consent form, which has got 2 parts. The second part is for mentally ill person or for the minor, and the first part is for the more than 18 years. And this is the Form 1, the RMP opinion form. Form E. So here in the Form 1, this is applicable only up to 20 weeks of gestation, that is Form 1. There's a separate form that is called as Form E. This is applicable for gestation of 20 weeks to 24 weeks of gestation. Beyond 20 weeks to 24 weeks of gestation. Now, Form 2 is nothing but a monthly reporting form by the head of the hospital. And this is the admission register, which has got all the details of the patient. So documentation for other types of abortion, other than MTPs, we come across the other types of abortions. They are the spontaneous abortions, inevitable, incomplete, and missed abortions. So none of these come under the purview of the MTP Act, and they not necessarily that you have to fill up all the forms that are relevant for MTP Act. So the documentation here is Form 1 is not required, and even the consent form also is not required. But a consent has to be taken for any other procedure, how you take it for any surgery. The consent has to be taken, and it need not be entered in the admission register. It has to be entered in the labor register or OT register or any other procedure register. It's also called as an evacuation register, which is separate from the admission register that is there for the MTP cases. So before performing the procedure, so the counseling of the woman is very much important regarding the termination of pregnancy, the method of termination that is being used, and even the details of the procedure that need to be done and its advantages, the disadvantages. It helps the woman to adopt a contraceptive method after the procedure. Even the contraceptive counseling has to be done before the start of the procedure. And the privacy has to be maintained throughout the pre-procedure as well as during the procedure. And the counseling should be non-judgmental while interacting with the woman. You can't tell that this procedure is better than the other. It is the woman who has to give an opinion. She has to take a choice to which procedure is useful for her. You can tell the advantages and disadvantages, but it is ultimately the woman who can take a choice of the method that is feasible for her. The MTP should not be denied irrespective of the woman's decision for concurrent contraceptions. You can't tell a woman that if you undergo the tubectomy or if you undergo the sterilization or if you undergo the contraception, I would like to offer you the MTP. Otherwise, I'm not going to offer. You're not supposed to tell that. Your job or your responsibility is to offer the MTP, but you can counsel the woman for the contraception, but you cannot force the woman for contraception. Now, role of ultrasound in MTP. According to the Government of India, it is imperative to understand that it is not mandatory or binding upon the clinician to advise or perform the ultrasound before undergoing MTP. The clinical finding of intrauterine pregnancy is enough to perform the MTP, both for medical as well as for surgical MTP. There are certain situations, though, where ultrasound can be useful before performing the MTP. Those situations are documentation of pregnancy when there is a doubt about the presence of a pregnancy. So when there is a doubt about the pregnancy, even after clinical examination, you need to do the ultrasound. And dating of the pregnancy, when there is disparity in the dates of the pregnancy and the clinical examination regarding the weeks of gestation, then at that time the ultrasound is necessary. And to diagnose the coexisting mass like fibroid or helping determine its size and location. And of course, it can be useful for the congenital uterine anomalies. And of course, it should not be missed, that is the ectopic gestation. The diagnosis of ectopic gestation, the vesicular mole, or the missed abortion can be diagnosed by ultrasound. Only for these, the ultrasound can be done. Otherwise, the clinical examination alone will help you or enough for you to perform the MTP, whether medical or surgical. And this ultrasound is before performing the MTP. Now, after performing the MTP, that is the role of the ultrasound. So what is the use of ultrasound after the procedure is done? The mean endometrial thickness 24 hours after using the misoprostol in women with a complete medical abortion may range from 7.6 to 29 mm. And 1 week after the abortion, the mean thickness was 11.3 mm, but ranged from 1.6 to 24.9 mm. A thickness of more than 15 mm is suspicious for incomplete abortion. So this you have to keep it in mind. So whenever you do the ultrasound after medical methods of abortion or any surgical MTP, the thickness you're going to check. So it may vary from 1.6 to 24.9 mm, but anything more than 15 mm, you have to be suspicious of the incomplete abortion. Now, what do you mean by a failed medical abortion? It is the presence of cardiac activity 2 weeks after the dose of misoprostol indicates a failed medical abortion. The patient complains of continuation of amenorrhea or pregnancy symptoms. Ultrasound is to be done to rule out the continuation of pregnancy. Now, the pain management in the abortion. The use of NSAIDs is recommended during medical abortion. The most commonly used NSAID is ibuprofen in the dose of 400 to 800 milligram at the initiation of misoprostol. It is repeated 6 to 8 hours as needed. In case of surgical abortion, it has to be started 30 minutes prior to the procedure. That is, the ibuprofen or naproxen can be started. Paracetamol is not recommended because they have done the studies and they have come to a conclusion that it is not better than any placebo. So that's why the ibuprofen is preferred over the paracetamol. Now, medical methods of abortion. So why we prefer the medical method of abortion and why the government of India is persisting all the government institutions and training the medical officers to go with the medical methods of abortion, because it has got many advantages, like abortion can be offered at an early stage of pregnancy and the privacy is maintained here. So only if the patient comes to the service provider, the privacy can be maintained and it is easy to take. Anesthesia is not required and it is non-invasive, no instruments are used, and so there is no injury. So these are the advantages of medical methods of abortion. The limitations are, now the 3 visits are required for the medical methods of abortion, and the patient will bleed for minimum period of 8 to 13 days. That is, the average duration of bleeding following the medical method of abortion is 8 to 13 days. And MMA drugs have got side effects. For example, the mifegest and the misoprostol. And the risk of fetal malformations are present if the pregnancy continues because of the misoprostol. So these are some of the disadvantages of the MMA. Now, indications and contraindications for medical methods. The indications are women seeking termination of pregnancy up to 9 weeks. So medical methods of abortion can be given up to 9 weeks of pregnancy, that is 63 days from the LMP with regular cycles. There are certain contraindications like anemia, ectopic pregnancy, undiagnosed adnexal mass, uncontrolled hypertension, adrenal failure, severe renal, liver or respiratory disease, inherited porphyrias, uncontrolled seizure disorders, and allergic to mifepristone or misoprostol or any other prostaglandins, and in case of glaucoma. So these are certain contraindications for prescribing the medical methods of abortion. Now, conditions for special precautions in MMA. So there are special situations where we came across where we can prescribe the medical methods of abortion, but you have to keep it in mind that the benefit should outweigh the risk of that condition. For example, a pregnancy with IUCD in situ. A patient comes with IUCD in situ and she wants to terminate her pregnancy. So first you have to remove the IUCD before giving the drugs. And pregnancy with a uterine scar. So a patient who has undergone LSCS and soon after the LSCS she may conceive and she comes to us for the medical method of abortion. Of course, the misoprostol is not contraindicated in a previous scarred uterus, but it can be used with caution. So it can, although safe, exercise caution with history of the scar on the uterus. Now, bronchial asthma. Bronchial asthma cases, the misoprostol can be used because it's a bronchodilator, but no other prostaglandins can be used. So you can use it in case of bronchial asthma also. And pregnancy with fibroid also, you have to take a special caution should be taken with the case of pregnancy with fibroid. And women on antitubercular drugs. The efficacy of the MMA drugs may be reduced because the woman is taking the ATT. So you have to be careful in a patient who is on ATT drugs. And pre-existing heart disease are the cardiovascular risk factors. The current long-term systemic steroid therapy or anticoagulant therapy. So here you have to think of the benefits are better. If the benefits are more than the risk, then you may have to give the medical methods of abortion. Now, mifepristone, as you know, the mechanism of action of the mifepristone is it is an anti-progesterone where it has got more affinity to the progesterone receptor than compared to the progesterone. So it helps in it causes the necrosis of the uterine lining and detachment of the implanted embryo. Along with the anti-progesterone action, it also causes the cervical softening and increased production of prostaglandins leading to uterine contractions. It sensitizes the uterus to the effect of prostaglandins, and small percentage, for example, 3% of the women may expel with the mifepristone alone or may have bleeding with the mifepristone alone. Misoprostol, it's a prostaglandin E1 analog. It binds to the myometrial cells, causing the strong uterine contractions, cervical softening, and dilatation. Now, the misoprostol, once the patient has taken this MMA drugs, you cannot continue the pregnancy because the misoprostol has got the teratogenic effect that is called as the Mobius syndrome, or any limb abnormalities may be present. So that's the reason why if the patient has taken MMA, you cannot continue the pregnancy, you need to terminate the pregnancy. So effectiveness of misoprostol. So the route of administration of misoprostol is important. All of us should know that the sublingual route, buccal route, vaginal route, and the oral route. So the peak level attained and the bioavailability. The sublingual route, it rapidly gets a peak level attains at 30 minutes and it has got long duration of action, that is 6 hours. And longest duration, that is the vaginal route, has got the longest duration, that is more than 6 hours. And the buccal route has got the 3 hours. Whereas the oral route has got the short duration, that is only for 2 hours. It is rapidly attains the peak level and it is for short duration. So the oral route is not advised in case of MMA, but the sublingual, vaginal, and buccal route is been advised in case of medical methods of abortion. So this is the drug protocol that is devised by the government of India, that is the NHM guidelines. So on the first day, according to that, the 3 visits are required. So the first visit on day 1, the patient has to receive the 200 milligram mifepristone. And if the patient is Rh negative, anti-D has to be given on the day 1st of the MMA. So this you have to keep it in mind. The anti-D has to be given on the day 1 of the MMA drug protocol. And the second visit is on the 3rd day, that is day 3. Here, 800 microgram misoprostol, that is the 4 tablets of misoprostol has to be given sublingual route, buccal route, and vaginal route. So it is advised sublingual, buccal, or vaginal route. Oral route is advised only for gestation less than 7 weeks. So if it is more than 7 weeks, oral route may not be of much use or it may have delay in causing the abortions. The 3rd visit is on the day 15. So you have to confirm the completeness of the abortion and offer any contraception if not already done. So day 15, you have to confirm either by doing the clinical examination or by ultrasound whether the abortion is complete or not. And the contraception, it can be advised at this period. So this is the MMA drug protocol that is followed by most of us. This is the MMA card designed by the government of India, where the mother is given this, pregnant woman is given this card so that she can keep a track of the days and the visit. And if any complications may occur, she has to report to the institution immediately or to the clinic. So effectiveness of MMA, it is 95 to 99% of the time it is successful, and in only 1 to 2% it causes incomplete abortion or heavy bleeding may be present in 0.1 to 0.2% of the cases. The side effects of MMA drugs are, it may cause abdominal pain, fever with chills, the GI side effects, headache and dizziness. And sometimes the severe vaginal bleeding may be present. If there is severe vaginal bleeding, additional dose of misoprostol or vacuum aspiration has to be done. And there may be incomplete abortion or continuation of pregnancy or may be associated with infection. Very rare with medical methods of abortion. Now, what happens after giving the medical methods of abortion? Sometimes you may encounter that there is either an incomplete abortion or there may be continuation of pregnancy. So if you encounter a patient who has not expelled the products of conception, there are varieties of patients. For example, a patient may come with incomplete abortion, and on examination, if you find there are products of conception at the os, then you have to do the digital evacuation. If on examination, if you find there are no products of conception at the os, then you need to give one more misoprostol, that is misoprostol 600 microgram oral or 400 microgram sublingual can be repeated in such cases of incomplete abortion. Now, following the ultrasound, if you find that if the gestation sac is visible but is non-viable after the MMA, then additional dose of misoprostol can be given. But you have to wait for 1 week for the completeness of the abortion to occur. It doesn't occur immediately. And if the ultrasound shows a viable gestation sac, that is the cardiac activity is present, then the vacuum aspiration has to be done instead of going for another dose of misoprostol. This has to be kept in mind for a case of incomplete abortion or the failed medical abortion. The next is the vacuum aspiration. So the vacuum aspiration, there are two types, manual vacuum aspiration or the electric vacuum aspiration. So the termination of pregnancy up to 12 weeks uterine size, the indications are, so you can you can do the procedure up to 12 weeks of gestation. It can be done even for incomplete abortion up to 12 weeks or missed abortion up to 12 weeks or a molar pregnancy up to 12 weeks. Contraindications are beyond 12 weeks if the pregnancy is beyond 12 weeks and acute cervicitis or suspected uterine perforation. Caution should be exercised in case of pre-existing medical conditions or history of bleeding disorder or multiple fibroid cases. So this is the manual vacuum aspirator that has been used in many of the centers in the government institutions. Nowadays, the DNC is contraindicated. We should not do dilatation and curettage, but manual vacuum aspiration is the best method to remove the products of conception and easy to use. Even the MBBS doctors have been trained to do that. So the cannula that has to be used depending on the size of the cannula, depending on the uterine size, the size of the cannula has to be used. So most of you know that signs of the procedure completion is the gritty sensation over the surface and the red or pink foam without tissue passing through the cannula, the cervix gripping over the cannula and uterus contracting around the cannula. Electric vacuum aspiration can also be done. It's a constant level of vacuum is maintained after reaching the above level. That is the 600 to 660 millimeters of mercury. A vacuum has to be created to remove the products of conception. So for surgical procedure, it is for first trimester, it is the manual vacuum aspiration and the electric vacuum aspiration can be done. Now, infection prevention, antibiotic prophylaxis in abortion. According to the NICE guidelines, that is September 2019, antibiotic prophylaxis for medical abortion is controversial. So what are the then why we should use the antibiotics? Antibiotics are to be used only in medication abortion cases with high risk of infection or if the screen positive for sexually transmitted infection and not routinely, because it may increase the antibiotic resistance and adherence will also be there. So antibiotic prophylaxis should be used only in the high-risk cases of infection. The drugs used are oral azithromycin, doxycycline, and oral or rectal metronidazole. A 3-day course is enough. Surgical abortion, the antibiotic prophylaxis most of us use. The Cochrane review showed the effectiveness of nitroimidazoles such as metronidazole, tetracyclines like doxycycline and beta-lactams like amoxicillin. A 7-day course of doxycycline is currently used in practice, but a 3-day course seems more logical. Now, conditions requiring immediate attention post-procedure. So, following the surgical abortions, or a patient may have tachycardia, hypotension, or giddiness, excessive vaginal bleeding. Excessive vaginal bleeding, we call it as an excessive vaginal bleeding if the patient has got 2 long pads that has been soaked for 1 hour for a consecutive 2 hours. Then you call it as excessive vaginal bleeding. Then the patient may have severe abdominal pain or cramps may be a sign of uterine perforation. All this has to be kept in mind following the manual vacuum aspiration. The conditions requiring immediate attention in the recovery period is the fainting and vomiting, fever with chills, distended tender abdomen, the foul smelling discharge per vagina, and cramping and bleeding more than the normal menses. Now, this was about the medical methods of abortion and the surgical methods, that is the MVA and electric vacuum aspiration. Now, following the abortion, persuade the woman to acquire or to use any of the contraceptive method. The contraception should be involved in the contraception should be a part of the counseling part, because most of the unsafe abortions can be avoided if you offer the contraception for the woman. So many of the contraceptives are available free of cost by the government of India. So after the first trimester abortion, that is following the medical methods of abortion, what are the contraceptions that you are supposed to advise? Condoms anytime it can be advised, because after the first trimester abortion, don't wait for her to resume the menstruation and then offer her the contraception. It has to be offered before the onset of the menstruation, because the ovulation will return following the medical methods of abortion. The ovulation may return as early as 12th day of the evacuation, or maybe sometimes 8 days following the evacuation. So that's why you need to give the contraception as soon as the patient is being offered the MTP, be it MMA or the surgical abortions. Now the hormones that are being used, that is the combined oral contraceptive pills, the injection MPA, which is being provided free of cost by the government of India, called as the injection Antara, and Centrochrome, that is the by the government of India. So you can prescribe these contraceptions on day 3, that is day 3, when the patient comes for misoprostol administration, you have to start the contraceptives on day 3. And IUCD can be given only around day 15. On day 15, you're going to confirm the abortion is complete or not, either by clinical examination or by doing the ultrasound. Once you confirm that the abortion is complete, the IUCD can be reasonably placed. So it can be used on day 15 of the MMA protocol. Now, female sterilization, it's better to do the female sterilization after she resumed the menstrual cycle, first menstrual cycle. And of course, the vasectomy can be done anytime. Timing of initiation, that is following the vacuum aspiration or for induced or incomplete abortions, or that is following the surgical abortions. So condoms is same as soon as she resumes her sexual activity, and the combined oral contraceptive pills, the injection MPA or the Centrochrome, can be started immediately following the surgical abortion, or maybe up to 7 days you can give it. IUCD can be inserted immediately, that is called as post-abortion IUCD. So we follow in our institute, following the abortion, we insert the IUCD. So it can be inserted immediately following the abortion, or up to 12 days of the abortion it can be inserted, provided the abortion is complete and there's no injury or there's no infection. So IUCD can be placed immediately or up to 12 days of abortion. Now, female sterilization can be done concurrently or up to 7 days. Male sterilization anytime it can be advised. This was about the first trimester abortion. Next is the second trimester abortion. The second trimester termination methods, the methods used are medical and surgical methods. The medical methods are mifepristone and misoprostol regimen, the misoprostol alone regimen, the extra amniotic ethacridine lactate supplemented by oxytocin. Of course, it is not available nowadays, and mechanical methods supplemented by oxytocin. Most of the time, we use the first two methods as a second trimester abortion methods. The surgical methods are dilatation and evacuation and hysterectomy. So mifepristone and misoprostol regimen, according to the WHO 2018, 200 milligram oral mifepristone has to be given. 36 to 48 hours later, the 400 microgram vaginal, sublingual or buccal misoprostol every 3 hours has to be given for a maximum of 5 doses. So here the oral route is not being advised. So it is the vaginal, sublingual or buccal route is been advised, that is the 400 microgram of misoprostol. It has to be given every 3 hours for a maximum of 5 doses. This is the protocol that is used for the second trimester abortion. Now, misoprostol alone here, misoprostol 400 microgram can be used vaginal, sublingual or buccal route. Every 3 hours can be used for a maximum period of 5 doses. So this is called as this is according to the WHO 2018, the misoprostol alone protocol can be used. Surgical methods, dilatation and evacuation and hysterectomy can be done if there is failed medical or the surgical procedures. Then after second trimester abortion, the contraception that can be advised are condoms as soon as she resumes her sexual activity, the hormonals, that is the combined oral contraceptive pills, the injections MPA, the centrochroman can be advised immediately or up to 7 days. IUCD has to be inserted immediately or up to 12 days of abortion. The female sterilization can be performed concurrently or up to 7 days. The complications of abortions, a brief, I would like to tell about the complications. That is the hemorrhage, perforation, the shock and anesthetic complications. So there's a flow chart. If you find a person, a woman coming with the vaginal bleeding, but she's clinically stable. And so if the POC, products of conception, are felt in the cervical canal, it has to be digitally evacuated. And if you don't feel them, you have to do the ultrasound and see whether there is products of conception are present or not, or you can go ahead with the IV fluids and oxytocin or vacuum aspiration. Now, a patient coming with the incomplete abortion or with the excessive vaginal bleeding and she's clinically unstable. So first you have to stabilize the woman, ensure airway is open, vital signs has to be checked, elevate her feet, oxygen has to be given, IV fluids, antibiotics and oxytocin has to be given. Now, uterus is atonic and soft boggy uterus, then oxytocin or prostaglandins can be given and followed by vacuum aspiration. Digital evacuation has to be done if they are visible at the cervical or vaginal region. Incomplete abortion, vacuum aspiration has to be done. And if there is a suspicion of intra-abdominal injury or perforation, the laparotomy can be advised. Now, if you find there is a uterine perforation, you have to look into the signs and symptoms of uterine perforation, stabilize the patient, and signs of surgical emergencies like rigid abdomen is present, persistent blood pressure, persistent low BP, shock, not stable even after 1 to 3 liters of IV fluids, and abdominal X-ray suggest perforation under shows the air under the diaphragm, and in such cases, emergency laparotomy has to be advised. In case of sepsis, so the sepsis have to be dealt with by the detailed history and physical examination. Pelvic examination has to be done to see if there are any pus coming out from the cervix or the vagina, or if there is any uterine subinvolution, tenderness is present, or any foreign body is present in the vagina. So in such cases, the initial treatment is to ensure the airway, check vital signs, oxygen has to be given, IV fluids, and maintain the urine input and output chart. So you have to go for the broad spectrum. Antibiotics has to be given and vacuum aspiration has to be done if the woman is stable. And if you suspect DIC, the blood has to be transfused, blood and blood components has to be transfused. And if you suspect gas gangrene, that is tetanus, then you have to give the patient has to be initial stabilization has to be done, and then later on the evacuation has to be done. And if you suspect a perforation, then laparotomy has to be done. So this was about the complications, and even the patient may come come in the shock also, the management will be to this clinical assessment has to be done, stabilize the woman, and then treat accordingly whether it is incomplete or any perforation is present.
Dr. Usha,
Yes, ma'am.
I think we are overshooting the time and we
Last,
need
ma'am.
to-
Over, ma'am.
Okay,
So this is the last slide.
okay.
So I would like to tell that since many 15 million abortions are undertaken each year in India, greatest challenge is to ensure easy access to safe legal abortion provided by an adequate system. So this can be done by training and certifying more medical doctors and streamlining the process of approving the private sectors and ensuring adequate supply in the government hospitals, improving the quality of abortion and contraceptive services, and even the recently accepted modality of telemedicine to provide early medical abortion also can be taken into consideration. So if one does not support legal abortion, in effect, one is supporting the illegal abortion as told by the Professor Arul Kumaran. So the take-home message is don't refuse any woman if she seeks for the abortion care. So there are many options that are available. So kindly request all of you not to send the woman back if the woman comes for the abortion, provided the sex determination has to be kept in mind. But it's only 9% of the women coming for the sex detection and abortion, but remaining 91% require abortion services. Thank you one and all. And thanks for giving me an opportunity for sharing the topic of MTP in this webinar. Thank you one and all.
Thank you, Usha madam. It is a very nice presentation. You have covered almost all the points with respect to the medical
Thank you,
term.
sir. Thank you, sir.
Thank you.
Thank you, Usha, for the extensive coverage and including all the topics relevant to the MTP in your talk.
Thank you, ma'am.
Thank you so much.
Thank you.
Yeah.
Dr.
Any
Ashley
questions?
Suman.
I think we can put it in the
Well
chat
presented,
box.
Usha.
Will be answered later.
Yeah, well presented, and you have covered everything: first trimester, second trimester,
Thank you,
pre-operative,
ma'am.
post-operative, everything, and it was wonderful.
Thank you, ma'am.
Thank you.
Thank you all the chairpersons and Dr. Usha for your vibrant and exhaustive talk. Thank you. We close with the session 1 now and moving on to session 2. It is another interesting session what we are doing here, and as Dr. MC Patel sir had described, it is the reverse panel, and the reverse panel stumped the expert, and it is on MTP Act. Sir is going to be the expert who will answer all the panelists, and panelists are given the questions, and the panelists are going to ask those questions. Other than that, if they have any other questions or some expert input from the seniors are also welcome. So first of all, let me welcome Dr. MC Patel. Sir, do you want me to introduce again?
No, it will do. It will do.
Okay, fine. Thank you so much, sir. So sir is the expert, and I will just open my screen to ask keep the questions in front of me. The first question is from Dr. Nagaratna Kuntoji.
I think Dr. Usha madam has not log out from the screen sharing.
Okay, yes.
No, sir. Okay, fine.
Yeah, sorry, Dr. Usha.
Yes,
Since,
ma'am. I'll stop sharing.
Yes,
fine.
yes,
Since
yes.
I opened my screen, I could not see that. Anyway, thank you for your cooperation.
Thank you,
Sir,
ma'am.
I'm proceeding with the reverse panel. Sir is ready to take all the question
Yes.
and answer, and let us enlighten.
Before you go with reverse panel, let me share my screen only for 2 minutes.
Fine, sir.
My humble appeal for this.
Sir, Gangambika Nishti madam is seen there.
We will have their blessing after this.
Yes, sir.
Respected seniors and dear colleagues, serving proxy for years together on this auspicious day with folded hands and down head. I seek your guidance, blessings, and support to endorse my candidature for the post of proxy president year 2026, election year 2026.
Your screen is not visible.
Their screen is not being shared.
Screen is not visible.
No, sir.
No, sir.
Only 1 minute. Only 1 minute.
We thought that you are in the process of sharing.
No, no. Okay.
Fine, fine.
I assure to serve Oxy in the same way with the same का अंतिम लक्षण है सिंहासन चढ़ते something going wrong. I think it's not supporting.
We saw the beginning of the video clipping, but it disappeared.
No. Only 1 minute. Now, is it seen?
No, sir.
Nice, sir. No.
No, still not.
The voice is not so clear.
Screen
No
also.
issue, chal. If it is not seen, then let it go. Okay. Carry on with our program.
Meanwhile, you can tell us something and enlighten us on and brief about the introduction of the talk, sir, about the MTP Act, or I will proceed with the question.
No, you can proceed. We will
Fine.
cover it during
Okay.
that.
Okay, fine. Thank you. So welcome all the panelists across Karnataka, the selected societies. The first question is to
But
Dr.
Rekha, Nesti madam has joined.
Yes. Yeah,
So let us
that's
have
what I-
blessings from her, and
Yeah.
then we will be.
Yeah, that's what I told, sir. Fine. Madam Gangambika, madam, we would like to hear
please,
from you.
I'm not
we
able
welcome
to
you.
hear clearly. Hello.
Yes,
Yes,
madam,
madam,
welcome.
please. Madam, please proceed.
Tell me.
Yeah,
My voice is not so louder. I cannot hear you.
No, we can hear you. We are welcoming you to the
Later, I
program
just,
as guest of honor, and we would like to listen from you, madam.
Madam,
From
hang on,
some
okay.
words. Just muted herself. Can I proceed with the questions, sir?
Oh, yes.
Okay.
But madam is seen on video. But is there anything wrong with her audio?
It's not.
Yes, we can hear you, madam. Carry on.
Once again, leave the meeting and join because the voice is not so clear.
No, it is clear, madam.
No,
Please proceed.
you are audible and you are visible, madam. Please
Sir,
carry on.
actually, madam is in Hyderabad attending some family emergency, medical emergency. I think she's unable to connect to us correctly.
Okay. But,
No,
but
but she
otherwise
is connected, na?
we can see her, we can hear also.
Exactly.
She is not in a locale where she can talk freely, sir.
Okay, no issue.
Yeah.
Then we
I'm
can.
trying to join you people, but tomorrow is my family, means my husband's surgery. Tomorrow.
Okay,
Don't
very
mind.
sorry to hear that,
Okay,
madam.
Okay, madam.
Thank you.
Fine.
Thank you, madam, for sparing time to join to bless us. Thank you, and please take care.
Thank you, sir.
And we wish you all the best for tomorrow's surgery, madam.
Yes.
God bless
Thank
you. Fine.
Yes.
Thank you, madam. Thank you so much.
Continue the session, please.
Oh,
Yeah,
yes.
thank you, madam. We welcome Dr. Nagaratna Kuntoji, Madam. Madam is the President of Bagalkot Society. Madam, can you start with your question to Sir and let us have the interaction rolling?
Yeah, thank you, madam. Am I audible?
Yes, yes.
Yeah. Good evening, sir. Welcome to the webinar and the panel discussion. We have been doing MTP since so many years, but in 1971, for the first time, the MTP was legalized and the MTP Act came into existence. So before that, we were doing, after that also we are doing. So I just want to ask the question, sir. What was the need of this MTP Act? Was it really indicated or why it was brought in at that time?
So just you
We
mentioned
were one of the countries earliest who got the MTP Act even before US.
yes. So just you mentioned that MTP Act was enacted in 1971. So before that, any abortion services were considered illegal. So many a time patient used to go to quacks or ended into criminal abortion. And there were so many morbidities and mortality. So in 1966, government formed a committee, that is Santilal Shah Committee. And in that Santilal Shah Committee, 50% were doctor as a member and others were influenced by doctor. And I am happy to announce one representative from Foxy also was there in that very committee of Santilal Shah Committee. And they had a discussion for years together rather, because it was formed in 1966 and they came up with all this proposal in 1971. And this act was amended, act was enacted in 1971 to regularize abortion services and to make doctors safe who are giving their abortion services as per protocols and as per MTP Act's provision. And after this act in 1971, rules and regulation were formed in 1975. So as such, this act was enacted in 1971, but official services as per rules and regulation were started in 1975. And just mentioned by Usha Madam also during her lecture, there was amendment in 2003. And in that amendment, powers were delegated to district level committee as far as registration of center is concerned and regulation of these centers are concerned. And again, just we know in 2020 and 21, there were some more amendments and rules were also amended. And now it is called Amended Rule 2021. So now abortion services are legalized. Yes, over to you.
Thank you. Thank you, sir. Explaining about MTP Act and its evolution in detail. Thank you so much. And Dr. Shobha Shavi, she's the Secretary of Bagalkot Society. Dr. Shobha, can you start your question to sir and
Yes,
get
madam.
the answer? Fine.
Yeah. Madam, sir, I want to know, there's one situation wherein a couple comes saying that they're married and the lady is pregnant 7 weeks and they get aborted because they have some problem at home. But after 1 year, I get a legal notice saying that that girl has complained it was a case of rape. And I have done the MTP illegally with force. So what should we do, sir, in this situation? When they came as husband and wife. They had Aadhaar card, everything. But after 1 year, I get a legal notice saying that wife has complained that husband has forced her to go for MTP.
So the same situation Dr. Bellard had mentioned during his speech in inauguration part. So here, as far as MTP services are concerned, age matters. Irrespective of her marital status, she can avail services of abortion, but she should be major, she should be mentally sound. So if she is mentally sound, if she is major, she can give consent for termination of pregnancy, irrespective whether she is married, whether she is not married. But in this situation, she came with her boyfriend, she was major, your center is registered, you are qualified, you can very well terminate pregnancy. But just like this, it happened in state of Gujarat also. After 1 year, police came that very boy has decline of getting married because promise was given to get married, and now he is not ready to get married, that lady. So promise given for marriage is declined. So consent given for intercourse against that promise, and now he is not fulfilling that promise. So it becomes a case of rape. So this kind of situation many times we have to face, but not to end up into problem. What we should do when patient is major, when patient is unmarried, in her own handwriting, we will have to take in a writing. This is a result of consensual sex. I have no complaint against anybody, and I do not want to inform police. If patient has given in writing, in her own handwriting like this, you are safe, because you never know that in future she will lodge a complaint against that very boy. In this particular case, she came with that boy. Many times patient may come alone or any other friend, not necessarily her boyfriend or so. So in this situation, if patient goes like this in a writing, then you are safe. And as far as Aadhaar card part is concerned, for age verification, if you have asked for Aadhaar card, if you have asked for Xerox copy, then that Xerox copy of Aadhaar card should be attested by that very patient only. So even if it is a fake Aadhaar card, because it happened in state of Tamil Nadu only in recent past, that Aadhaar card was fake. But once patient signs that Aadhaar card attestation, then it becomes a case of forgery. So we are safe. Patient had made a mistake to produce fake Aadhaar card, and she has signed in that very Xerox copy of Aadhaar card as it to be true. So in this case, have a signature of patient in that very Aadhaar card.
Okay. Actually, they were married, sir, when they came to me. But
Yes.
they filed for divorce. And
No.
in divorce letter, she wrote like that. Forcefully, she was meant to.
Even if she is not married, then also if you have taken like this, you can
Okay.
very well terminate pregnancy. Your center should be registered and you are qualified person. So no issue. And when she was married, then also there was no issue. In future, if at all there was quarrel in between in family, and she had complained that it was forceful abortion.
Correct.
And many a time allegation could be on part of patient that there was conspiracy between my in-laws and doctor. And with that conspiracy, my pregnancy was terminated forcefully. But when patient signs the document on consent, and when patient is major, when patient is mentally sound, it is taken into consideration in court of law as a valid evidence, and she had given consent without any force, without any coercion. So it doesn't stand in court of law. You are safe legally.
Thank you, sir. Thank you.
Welcome.
Thanks, Dr. Shobha. Are you clear on that?
Yes, madam. Yes.
Fine. Thank you so much. We move on to the third panelist, Dr. Sumaya Firdaus Patel. Madam is the president of Belgaum Society. Over to you, madam.
Good evening, sir.
Good evening.
Sir, I would like to know what were the important provisions of the MTP Act?
So there are so many provisions, but up to 20 weeks of pregnancy, there are 4 major provisions as far as termination of pregnancy legally is concerned. One, if pregnancy continues, then it could be mentally and physically dangerous for patient. So physical and mental risk to the patient, it is one indication. Second is same way. If pregnancy is continued and baby is born, then it is all likely that baby will born with lethal physical abnormality. So in this type of situation, pregnancy can be terminated. One more indication is pregnancy due to failure of contraception. This is one more indication, and one more indication, pregnancy due to rape. So these are the 4 indication or grounds for termination of pregnancy up to 20 weeks of pregnancy.
Okay, sir. Thank you.
Yeah. Is that
And
kind of
Sumaya madam, my visit to Belgaum is still pending.
Yes, sir. It is on 17th of September.
So
We are going to call you
I
soon.
definitely come.
Thank you, Dr. Sumaya Madam and the Belgaum Society. Next question by Dr. Shweta Patil. I think Dr. Shweta is not there because of some emergency. I request Dr. Sumaya, being on behalf of the Belgaum Society, to ask the question. Do you have Dr. Sumaya, or should I read out?
No, I just want to know what are the newer amendments to these provisions? Anything else has been added? What are the new amendments in this act? Sir,
So
can you enlighten?
previously it was allowed to terminate pregnancy up to 20 weeks of pregnancy. And with this amendment, even beyond 20 weeks, pregnancy can be terminated. Up to 24 weeks, there are some other indications. And beyond 24 weeks, there are some other indications. So pregnancy can be terminated at any given gestation. But there are some provisions accordingly, and we will discuss gradually for that also.
Is Dr. Shweta there? Okay, sir, Dr. Shweta's question to you was there any punishment included in the act?
Yes.
Rather, what are all the punishment that?
Yes. As far as MTP Act's punishment part is concerned, if any unregistered person who is not registered medical practitioner and he does any MTP, or any qualified or unqualified person who does abortion services at unregistered place, then there are provisions of imprisonment up to 2 to 7 years. So even if you are qualified, you cannot terminate pregnancy at unregistered place. And if you are not registered medical practitioner, you cannot terminate pregnancy even at registered place also. There is a provision of imprisonment 2 to 7 years. And as far as some inaccuracy in records are concerned related to MTP, then fine of ₹1,000 is there. So in this regard, MTP Act is doctor friendly as far as record part is concerned. In PCPNDT Act, if it is inaccuracy of record and if it is proved in court of law, there could be imprisonment 1 to 3 years also. And in few of the cases, 3 to 5 years also. But in MTP part, if records are inaccurate, then fine of ₹1,000 will be there. So these are the provisions for punishment.
Now our attention is to Dr. Subhash Ramanagowda Mudunur. Sir is a president of Belgaum Society. Over to you, sir.
Bijapur.
Yes, sir.
Sorry. Yes.
Sir, pranam, sir.
Yes,
I have a very simple question. In the provision of the act, there is immunity to the registered medical practitioner who has done it in good faith. Something goes wrong. It is written in the book that there is immunity. Is it what type of immunity and how it stands in the court of law?
So in section 3 of MTP Act, it is very specifically mentioned, notwithstanding anything contained in Indian Penal Code or any law time being in force, doctor, registered medical practitioner will not be held liable if he has terminated pregnancy as per provision of MTP Act 1971. So it is very specifically mentioned. Here word accordance is very much important. If he has terminated pregnancy in accordance with provision of MTP Act 1971. So not to end up into any kind of penal provisions of IPC, that is section 312 to 316. We have to terminate pregnancy as per provision of MTP Act 1971 only. Center should be registered, person should be qualified. There should be ground which is mentioned in MTP Act for termination of pregnancy. It should be in a hygienic manner. So which are the requisites in MTP Act 1971? And if you have terminated pregnancy in accordance, then you are out of purview of IPC and you have immunity not to end up into this kind of problems.
Sir, my question is, all the provisions are followed, patient ends up with a severe complication, admitted in ICU or dies. Then patient relatives violence, police might book a case, take action. What is to be done to police?
It is just like in any other complications also. It is no specific rules and regulation for MTP complication only. Even if in your, say for example, if it is a case of cesarean section, if it is a case of hysterectomy, or any other, say for example, normal labor, and she ended into PPH, and in spite of all your care and caution, patient expired. So in this type of situation, patient's relative are free to go for litigation. You will have only to prove that which kind of care in that very given situation you have taken. You should have taken care as any prudent gynecologist would have taken care in that very given situation. If you can prove in court of law by your documentation, then you are out of problem. Because in court of law, known complications are taken into consideration, which are mentioned in our standard textbook. Say for example, which are the common complications during cesarean section. It is mentioned in our standard textbook of Williams or so. So if we go with these references, court also consider that these are the known complication of that very surgery or that very procedure. But complication is not negligence per se. Complication may occur at any time, at any place by anybody. But after having complication, did you diagnose that complication well in time? And did you manage that complication way in which any prudent gynecologist would have managed in given situation? If you can answer all those questions, then you are out of problem.
One more question, sir.
Yes, sir.
Misoprostol is a Schedule H drug, but it has become almost OTC, and people are writing using left and right, ends up with many complications, including ruptured ectopic, severe bleeding, shock, and even sometimes death also occurs. What is the way out for this?
So as such, it is not OTC product, and whosoever buys it or whosoever sells it is illegal. So if at all any litigation against any pharmacy, then he or she will be in a very big trouble. Why? Because just I mentioned about provision of punishment. If unregistered medical practitioner, that is who is not registered medical practitioner, and at unregistered place, so when he, that very person is not registered, so if any litigations happens, then he will be in big trouble. But unfortunately, till now, nobody has, any patient or patient party has lodged complaint against that very pharmacy or that very fellow who has sold that medicine. If at all, due to complication, say for example, just you mentioned that patient purchased from medical store and she ended into incomplete abortion, and with severe or profuse bleeding, she was brought to us. And during our treatment, if any complications occurs or patient expired, then whole burden of this litigation will be shifted to us only. As such, who is culprit? Both patient as well as that very pharmacy, because patient has directly gone to that pharmacy to purchase medicine, and she has taken medicine without advice of registered medical practitioner. And that very fellow who has sold the medicine, he will also be in a trouble. But somebody should come forward to have a litigation against this type of activity. Otherwise, this is a continuous process in our day-to-day practice.
But they don't give any documents or
yes, they do not issue any bill or receipt rather. So patient is unable to prove that that very medicine. But even then, if at all there is a complaint, and if drug controller is very keen enough to investigate case properly, he can ask how much this misoprostol or RU486 you purchase, and against which prescription you sold. So if there is no tally, then also drug controller also can issue a notice. Because in one of the case which happened in state of Gujarat only, one pharmacy, chemicals, chemist nearby one hospital. In those days, I am talking of when we were using ethacridine lactate for termination of second trimester termination. So what that chemist used to do, whosoever comes to purchase this ethacridine lactate, he sold and making a bill for one particular doctor, our own Foxian friends. and there was some problem related to PCPNDT, and it was came to notice of PCPNDT appropriate authority that from that very medical store, this doctor has purchased this much ethacridine lactate. And inquiry was against that very doctor who was as such innocent. And I was medical legal counselor for that doctor. Notice was issued to that doctor. Please show in this ethacridine lactate for which patient you have utilized all this and give all the information. As such, that doctor was innocent. Doctor has never purchased any ethacridine lactate from that very chemist. So we put simple question in court of law against that chemist. Can you show our prescription for any patient we have prescribed? And he was unable because we never prescribed. We were saved in court of law and action were taken against that very pharma people, chemist. So one should come forward with any complaint, then only this problem will be solved.
Thank you, sir. Thank you.
Thank you, Dr. Subhash, for that very important practical question. And thank you, sir, for enlightening us on that real case story so that we have learned something from that case. Next, I turn my question to the Secretary of Bijapur, Dr. Rajashri Aliwal. Dr. Rajashri, over to you, please.
Yes, thank you, Madam, for the opportunity. And Namaskar, sir.
Namaskar.
Patel, sir.
Namaskar.
Thank you so much for inviting me, sir.
Yes.
My question, I have a couple of questions, sir. First one is, what is the protocol in case of rape? How do we do MTPs in case of rape patients? Because what has happened in a couple of cases in our vicinity, the judges have asked for the products of conception.
Yes.
So if it's not stored or if you're giving medical abortion, then what?
So there are two situations. One situation, patient has come directly to you or with her relative. So in this situation, age matters. If patient is less than 18, then it becomes a case of POXO. So we will have to inform police first, dealing with anything. If she is major, and if she is not ready to complain against anybody in spite of this being a case of rape, because many times it happens that there could be some family members or some relative, and patient and relative who has brought patient, they are not ready to file complaint against that very fellow. So in this situation, of course, we can terminate pregnancy if our center is registered and we are qualified person. But we will have to preserve product of conception in saline. And when it is a case of POXO, less than 18 years, or when patient is keen to complain, then we will have to inform police, and we will have to inform police that this very patient had been to us, she is pregnant, she is willing to go for termination of pregnancy, and we are going to terminate her pregnancy tomorrow or any date which we have fixed. And you are requested to collect product of conception. So if you have informed police like this, you are out of problem. Even if police doesn't turn up for collection of product of conception, then there is problem on their side. But if we have preserved, if we have informed police to collect, we are out of problem. Because it is a good evidence as far as pregnancy is concerned. And if at all there is complaint, then it will be proved in court of law that she was pregnant and we had terminated pregnancy and we had handed over product of conception to the police.
Thank you, sir. Sir, one more question. In the PCPNDT form, there is a column which says, is there an indication for MTP? Yes or no? So radiologists say that who are we to comment on the MTP? So how to go about this? And
Yes.
supposing
Yes.
it is a minor, it's not a life-threatening anomaly. The patient doesn't want to continue.
Yes, yes.
Then what?
So in this type of situation, if at all you consider findings of your sonography report that this pregnancy should be terminated, then in that very common column, you can mention, should pregnancy be terminated? Yes, you can very well write. Nothing is wrong. If pregnancy terminated is one more column. In PCP-NDT Act Form F, last column, if pregnancy was terminated, yes, no. So at that very time, pregnancy is not terminated when you are filling up the forms for sonography. So you can very well go with no. Got the point?
Because now we are filling online, sir, in Karnataka.
In online
and
also.
in that column is not there, sir. MTP, whether it is
in
done or
Gujarat
not,
also,
only whether it is recommended.
In Gujarat also, we go with online as well as physical form. So last column is this. Was pregnancy terminated? Yes, no. But in that very column, you can very well say no, because at that very point, you are not going to terminate pregnancy.
Okay.
So you can mention yes or no as far as opinion to continue or to terminate pregnancy. Nothing wrong.
Okay. So last question from my side. For a medical abortion, while filling the 16-column admission register, so they write the admission date and then they write the date of discharge. So these patients, we don't, many times they are lost in follow-up. So what is to be done for that?
So in that very column, you have to simply write that it was medical termination of pregnancy. There was no admission. If it is on OPD.
Okay, you need not write anything there.
Or in last column of remark, you can mention in that last column also, this was medical termination and patient was not admitted.
Okay. Thank you, sir. Thank you so much.
Thank you, Dr. Rajeshri. I hope you have cleared your doubts. Thank you. Thank you, panelists and MC Patel sir, for continuing with this bright and interesting panel and occupying all of us in such a with lot of information. Now I
have one question.
Yes.
I have one question, sir.
Yes, madam.
Is it legally mandatory to have an attender or a relative with the patient for MTP? Is it legally mandatory or?
No, not mandatory, and it is not required also otherwise. Because as far as this MTP Act 1971 is concerned, this is to be kept secret. So if patient is insisting somebody to be present at the time of surgical evacuation or so, then we can allow, there is no problem. But it should be in a writing from patient, because otherwise patient will go for complaint also that it was breach of confidentiality. So we should be very careful to allow any attendance on part of patient. Otherwise, as per this MTP Act provisions are concerned, it is not required, because in consent also only patient will sign, no witness, because it is to be kept confidential.
Okay.
As per her.
And about this medical board, sir, suppose we have go ahead from the medical board after 24 weeks. Do we still have to approach the court for permission?
No, not at all. With this amendment, whenever case is more than 24 weeks, and if it is a fetal congenital anomaly, which are incompatible with life of fetus, lethal anomaly, you have a ground for termination of pregnancy, but you will have to refer that very case to medical board, and medical board will opine that pregnancy can be or should be terminated, and you can terminate pregnancy. No need to go for permission of court. If it is a case of rape, or if it is a case of POXO, then in this situation you will have to inform police, but not to go for permission of court, because medical board has conferred with power to opine that pregnancy should be or can be terminated.
Okay, sir. Thank you.
Thank you, Dr. Somaya. Now we address the Gulbarga Society. I request Dr. Mahananda Madam, President of Gulbarga Society, to clear her doubt and ask question to sir. Dr. Mahananda.
Yes, madam.
Yeah,
So,
thank you.
what is the latest amendment and how does it benefit the woman and the doctor?
So there are so many amendments, but can you specify for which amendment you want to ask me or to clarify the matter? Because amendment for contraception failure, amendment for opinion, amendment for weeks of gestation termination. So which amendment particularly?
Weeks of gestation, sir.
Weeks of gestation. So previously it was allowed up to 20 weeks of pregnancy. Now it is allowed beyond 20 weeks also. So more than 20 weeks and less than 24 weeks, with opinion of 2 registered medical practitioners, we can terminate pregnancy. But not in all the cases. There are some 7 indications given in this amendment rule, and if those indications are available, then we can terminate pregnancy up to 24 weeks of pregnancy with opinion of 2 registered medical practitioners. Say, for example, if it is a case of rape, if she is minor, if she is incest, if there is a change of marital status during ongoing pregnancy, say, for example, judicial separation, divorce, death of husband. So in this situation, if pregnancy has advanced 20 weeks and still it is less than 24 weeks, then with opinion of 2 registered medical practitioners, we can terminate pregnancy. One more indication, physical disability. So under Indian Physical Disability Act, there is a list of physical disability. And if any of your patient falls in that category of physical disability, in this situation, if pregnancy has advanced 20 weeks and still it is less than 24 weeks, we can terminate pregnancy with opinion of 2 registered medical practitioners. As far as congenital anomaly is concerned, if it is lethal one, incompatible with life of fetus, then we can terminate pregnancy more than 20 weeks, less than 24 weeks with opinion of 2 registered medical practitioners. One more area, mental retardation. If patient is mentally retarded, then also we can terminate pregnancy more than 20 and less than 24 weeks. But in this, certificate from psychiatrist is very much required. And one more indication on humanitarian ground. But in this, say for example, in era of COVID, there was notification on part of government that there should be minimum visit of patient to the hospital. So in this situation, if pregnancy has advanced 20 weeks and still it is less than 24 weeks, you can terminate pregnancy with opinion of 2 registered medical practitioners. But here burden of proof is on your shoulder to prove. So there should be notification on part of government in this type of situation. So these are some 6-7 indication in which we can terminate pregnancy up to 24 weeks of pregnancy. More than 24 weeks of pregnancy, we can avail opinion from medical board. But in this situation, medical board has also limitations. They are conferred with power to opine, but only in fetal congenital anomaly which are incompatible with life of fetus. Otherwise, medical board has no power to opine. So if pregnancy is more than 24 weeks, say for example, any gestational age, medical board can opine if it is a congenital anomaly lethal. One more area, if there is an acute emergency to save life of patient, if it is immediate necessary to save life of patient to terminate pregnancy, under section 5 of MTPA, you can terminate pregnancy at any given gestational age. But again, burden of proof is on your shoulder to prove that it was immediate necessary to terminate pregnancy to save life of patient. Say for example, if she is having malignant hypertension, 220 by 110, edema all over body, and she is imminent case of eclampsia or so, and to save life of patient, if you terminate pregnancy, then you are saved in court of law, because you are not terminating pregnancy at her will or so. It is medically indicated, and when it is medically indicated, then you are out of problem. But you will have to prove all this by your record. So your record should be updated as far as this type of cases are concerned.
Yeah.
Thank you.
So how does it benefit women and doctor?
Pardon?
Second question, sir. How does it benefit women and doctor?
So as far as this amendment part is concerned, say for example, more than 24 weeks, and if it is fetal congenital anomaly lethal, medical board can opine, and medical board is conferred with power and medical board is under obligation also. Medical board you have to opine within 3 days. So if opinion comes within 3 days, so before pregnancy advances, we can terminate pregnancy. So it is beneficial to patient. And as far as our part is concerned, being a treating doctor, because as per provision of this MTP Act, we can terminate pregnancy more than 24 weeks. So whatever we do, whatever we take any decision in good faith of patient, in provision of MTP Act, we are safe.
Hello. Hello, ma'am.
Yes.
At this point, even though, can I ask the question here?
Yes, Manpreet.
Sir, you just opined that after 24 weeks of gestation, the medical board, in the case of a lethal anomaly, can opine for termination and give permission.
Yes.
Trisomy 21 Downs is not a lethal anomaly. And we supposing diagnose it at 26 because the procedure is long, we get a quadruple, then we get a NIPT, and then finally we go to amnio, the report comes late. And I have crossed 26, 27 weeks and I diagnosed Downs. Now in this case, what do I do?
So medical board cannot opine. So in this situation, you will have to rush to Honorable High Court of respective state seeking writ petition, asking permission for termination of pregnancy.
Okay.
And in this type of situation, court are kind enough. We have so many judgments, more than 300 rather. Court has permitted to terminate pregnancy at any given gestational age in this type of situation.
How early the court will give judgments, sir? How many days?
MC Patel, sir,
Yes.
can I interfere?
Yes, sir.
Dr. Manpreet, it's a medical board which can decide because Down syndrome is a parental and the societal, burden. So though it is not a lethal anomaly, baby can survive, but how much it can. So medical board has a certain other responsibilities. They definitely look on this ground, and we have decently got the approval also on this.
Yes.
Sir,
Manpreet, 1 minute.
Legally,
Because in only 1 minute, Manpreet.
yes.
Because few of the medical boards in respective district, they have denied this permission. They go strictly with word congenital anomaly which are incompatible with life of fetus, and they interpret in this way that this is not incompatible with life of fetus straightway. So they deny. So in this situation, you will have to go to Honorable Court. If medical board is of opinion that this very pregnancy can be terminated, then you can very well terminate pregnancy, because medical board is conferred with power to opine within 3 days. And once medical board opines, then that very pregnancy should be terminated within 5 days. This is also given in this amendment rule 21. So this is very good in favor of patient, because previously what happened, whenever we were seeking permission before Honorable High Court, Honorable High Court were referring cases to medical board only, but there was no time limit. So many a time opinion asked at the gestational age of 22 or 24, and when opinion comes, pregnancy is 34, 36 weeks, and it had happened in one of the cases. So all these cases were taken into consideration in Lok Sabha also at the time of this amendment bill discussion, that not to end up into this type of situation, this amendment act is there, and medical board is formed, and medical board is conferred power to opine in this type of situation.
Sir, Manpreet, another question is why 26 weeks we have to wait for amnio? I'm not convinced, because see, if you do, no. What is important?
Patient who came to us after all the procedures, and by the time she turned up, she was 26. So I wanted to know where do I stand? It's not my patient, it's referred from outside, came to us 26 weeks, diagnosed as Down. So now where do we stand as far as MTP is concerned? We don't wait to 26 weeks for amnio at all, sir. You are absolutely right.
Now, one point is, see, if in that situation you refer to the medical board, if medical board denies it, ask the patients and their attendants to go to the court.
Yes, fine.
Because that's it. Because we cannot go and go to the court and take the approval. If the patients, they can seek the court opinion and get it done.
Dr. Billard, we have not to go before honorable court. Patient and patient party has to go. We are simply advising them this is the remedy to seek permission from honorable court. And there are advocates also for that. And there are so many judgments, just I mentioned prior. And one of our Foxian friend, Dr. Nikhil Datar from Mumbai, he was with me in this forming of uniform consent also. He had fought so many cases seeking permission before Honorable High Court, and in more than 250 cases, he has appeared seeking permission. So court is kind enough and liberal enough rather to give permission in this type of situation. But we should convince court that what is the problem, and if at all pregnancy continues and baby delivers, how it will be burden to that very family and to the society. And in usual course, if we can convince court is kind enough to give permission.
Sir, how long the court will take to give permission? Medical board will take 3 days. How long the court will take roughly?
It depends upon the workload of court. But in this type of situation, we have observed that high courts are very quick in giving dates in this type of situation, and within very short period they come up with this conclusion.
We have seen,
but if at all, because court straightway cannot give judgment, they may refer patient to medical board also, because courts are not doctors, so they will refer to medical board, and medical board is under obligation to opine within 3 days. So as soon as High Court summoned this to medical board to opine, it will be very quick, and with opinion of medical board, court will give judgment whether to terminate permit termination or not.
Sir, can I intervene, sir?
Yes.
So we had one case, we had one court order also, sir. We have done according to the court order, the termination of pregnancy also, sir. So we had one case of 26 weeks with anencephaly with central placenta previa. She had come to us. She had come to us with a court order.
Yes.
So we formed a medical board within the institute, and we opined it that patient requires termination since it was a lethal anomaly, which was detected late by one of the radiology. So that's why.
But was it clear in court's order that very pregnancy should be terminated?
Yes, sir. Yes,
then
sir.
why you went with the medical board? You can straightway terminate pregnancy.
So no, sir. At that time, this was 1 year back, sir.
Of course, 1 year back. But once court had permitted to terminate pregnancy, no need to go for medical board.
No, sir. The court has given the order to opine on the requirement of termination or not.
That is different story, different situation. If court has given verdict to have an opinion from medical board, then naturally one will have to go to medical board. But if straightway court has given a permission to terminate pregnancy, because in case of rape, usually what happens in case of rape, when pregnancy is very normal, medical board cannot opine. So in this type of situation, straightway medical board, court will give order to terminate pregnancy. But in this situation,
court will give an order.
Only 1 minute. But in this situation, if court feels that it is safe to terminate pregnancy with this much gestational age, then court may refer case to medical board to opine. Is it safe to terminate? And if medical board is of opinion, yes, it is safe to terminate, then court will give permission to terminate pregnancy at any given gestational age. Yes.
Yes, sir.
Dr. Pooja, you had some input there, or can I move on to the next question? Next person. Bellad, sir.
If I'm telling, if you don't want a court order for high risk cases also, and a medical board has opined, for example, this is a case with a central placenta previa, and we managed to do only on the basis of a medical board, and later they say like something goes wrong with the patient or some complication with the patient, whether the court intervenes here, sir.
Pooja madam, I mentioned during my discussion previous, there is provision in MTP Act, that is section 5. in that very section 5 is very specifically mentioned, if it is immediate necessary to save life of patient, if it is dial emergency, no need to go for medical board, no need to go for permission of court. You can very well terminate pregnancy.
Here she was not bleeding, sir. She's a case of a central placenta previa. And
She was not bleeding, but being a responsible gynecologist, you can predict that she may bleed at any time. And it could be lethal for her if she is not attended well in time and in a proper manner.
If any other case which appears is like normal, and sometimes we medical board opine about it and something goes wrong, whether court will intervene here or no, sir?
If medical board has opined and as per opinion of medical board, you have proceeded accordingly, then you are out of legal problem.
Okay, so we can be.
Sir, one point I just want. Central placenta previa is not an indication for termination of pregnancy. The patient has gone up to 40 weeks without bleeding, so there is no evidence. So we cannot, because the termination itself can kill the patient. That also there is a risk of but as far as obstetricians are concerned, we also must be very clear on the indication.
I mentioned that if it is immediate necessary to save life of patient,
this was
even if it is a central placenta previa and she comes with profuse bleeding, then what will you do? You can terminate.
That is, sir, that is the treatment.
Yes, that is the treatment of complication of pregnancy.
Not terminate.
So that is mentioned
not termination. It is a medical treatment for placenta previa bleeding patient. It's not medical termination of pregnancy.
That is why I mentioned the provision of section 5. Section 5 clearly mentions that if it is immediate necessary to save life of patient, you can terminate pregnancy. And in that very section, it is mentioned, even you can terminate pregnancy at unapproved place also. If place is not approved for termination of pregnancy, then also you can terminate pregnancy.
Yes, because it is an emergency.
Yes, it is an emergency.
Dr. Bellad, anything else? You want to tell something, sir?
I conveyed whatever I wanted. Sir, sorry, I interfered in between.
No. You are most welcome. Because
there are certain guidelines. Severe preeclampsia is there.
Yes.
The treatment we are giving, termination of pregnancy is a treatment.
It is a part of treatment.
So these are not called as MTP. See, PPROM. Patient has come at PPROM at 24 weeks, 26 weeks. We don't label them as MTPs.
Yes. So here comes provision of section 5, just I mentioned.
Yes. That is there. And peripartum cardiomyopathy.
Yes.
This is a challenging thing. I just want to tell
because
that.
In this way, how court interprets. Say, for example, just you mentioned it is a case of eclampsia. What is the treatment written in our standard textbook of this type of situation? Termination of pregnancy. So you can very well terminate pregnancy accordingly by normal delivery or by cesarean section as per condition. But it is not MTP as per provision of MTP Act 1971. It is a treatment of complication of pregnancy. So you are saved as per section 5 of MTP Act.
Sir, I have one question to you.
Yes.
See, now we are in the era of MTP, which is advanced period of gestation, but we don't know where the patient has undergone ultrasound. Who has determined the gender of the patient? We don't know. So in such situation, that is why we in our department, we have taken, other than congenital anomalies, second trimester terminations, we are not doing. Because that is one point. But, if somebody does, you please think before doing a second trimester termination. If she has undergone somewhere else the MTP, ultrasound, and there the gender determination is done, then they will not listen to you, because the court, it has been very clear, sir. They say that as an obstetrician, we should be analyzing where they have got the ultrasound done and all. But many times patients don't reveal this. So that is why, for safety of ourselves, we have stopped doing second trimester terminations. Because I want the others also opine. But what happens is, however they plead, sir, but I have seen them, they have done somewhere and something, and they do come. And they say that we are not interested in gender to know and all. They will tell, they will plead I want the obstetrician should be aware of this, because court will not protect us, sir, in that situation.
Yes.
That is one
there
point
are,
I wanted to convey.
two things we have to remember in this type of situation. Vulnerable group of patients, say for example, having one female child or two or more female children, and she has come for termination of pregnancy in second trimester with very normal pregnancy, we have to suspect that these are the patients. They might have gone somewhere for determination of sex. So just you mentioned, if it is normal, you never entertain termination of pregnancy. It is fine thing. One more area, can you deny? Many times this question also comes. So one more question in this type of situation is asked, is termination of pregnancy right of patient? No. There should be some indication which is mentioned in MTP Act 1971, then only you can terminate pregnancy. So in one of the case, court has very specifically mentioned that termination of pregnancy is not right of patient, and it is a prerogative of registered medical practitioner to decide as per indication given in MTP Act.
Sir, one intervention.
Yes,
Sir?
yes.
Sir, the failure of contraception up to 20 weeks is allowed. You suspect that some SD is done, but they demand our using contraception is failed. But
we have to be careful in those just I mentioned vulnerable group. One female child, more than two female children, then they are the patient who might have gone. We never know. We should be careful in this situation.
And
I was asked
outside, the sonography done outside.
Yes.
Actually.
I was asked a similar question in a court of law, sir. They asked me when I was speaking on a MTP and PCP NDT. They asked me one question: how will you prove your innocency when you are doing an MTP of a second trimester, telling that it is a failure of contraception? As I told, at that time I could answer. I will ask the history, like if she's having 2 or 3 female children, then maybe like okay, that is the reason she's going for that. Maybe she would have undergone sex determination.
Yes.
Then the question they asked me was, sometimes a primi gravida comes to you and maybe her family matters, and she tells that I want termination because of failure of termination, failure of contraception. And at that time, she has already got a sex determination, which I will not be knowing, and comes to me. And according to the amendment and all, I will have to do the termination. How will I prove my innocency here?
Up to 20 weeks of pregnancy, if she is primi and if there is a quarrel in the family, you can have one more ground also. Mental trauma to the patient if pregnancy is continued.
Sir, but mental trauma can be added in the...
Yes, it is one more indication.
It can be added, sir, but the problem is what Dr. Bellard sir is saying. It's a second gravida, not the first primi.
She mentioned primi.
Right, but I'm saying little bit different situation.
If it is second gravida and if she is having one female child, then we should be careful.
Yeah, we should be careful, but how can we defend ourselves not doing MTP because of some dicey situations like, as you said, the mental condition or failure of contraception?
One can very well refuse termination of pregnancy. It is not compulsory on part of doctor to go for termination of pregnancy when patient demands.
Okay. So, but what about she's a primi gravida? She has already gone a sex determination, and the radiologist is being caught. He is already in a court of law caught, and then I was asked, "You have done an MTP. Please come and give your opinion that you have done an MTP. Did you know that the sex determination was done?"
Naturally, patient would have not disclosed to you that she had been for sex determination.
Would say at that time was, I have followed all the rules. First of all, I being a registered medical practitioner working in a place where it is registered, I have followed all the forms. I have taken consent. Hence, I cannot know what is her mental or the whatever she was thinking behind it. So according to the laws, I have done my part. So I may not be knowing about the what.
In this situation, you are out of problem.
I argued.
You are right.
Thank you, Dr. Bellad and Dr. Pooja, for your great inputs. Now I turn my question to Dr. Anita Gaura. Madam is the Secretary of the Gulbarga Society. Madam, please go ahead with your question.
Good evening, everyone. So my question to you is, what are the common violations which we can, about the law, which we can see in the court?
Common violation, just I mentioned prior also, if termination of pregnancy is done at unapproved place or by unregistered medical practitioner. So these are the two situations, and in this provision of imprisonment 2 to 7 years.
Okay, sir.
So, sir, reiterates the fact that keep your papers up to date and be abreast with the law. Thank you, Dr. Anita, for your question. Now it is the Mandya Society that's coming up. Over to the Secretary of Mandya Society, Dr. Arjun Kumar, sir. Dr. Arjun, are you there?
Arjun? No issue. You can switch over to another.
Or can I ask his question on his behalf if he is not?
Oh, yes.
Okay. Sir, the question from Dr. Arjun is, are medical abortions also covered under the Act?
Naturally. It is a method of termination of pregnancy. So it will be covered, and it is in purview of MTP Act. We have to observe all the formality of MTP Act in this situation.
Thank you. So now it is Dr. Jyoti Mahesh who is asking the question to you, sir. Madam is the president of Tumkur Society. Dr. Jyoti, please talk to sir.
Yes, Jyoti madam.
Dr. Jyoti.
Is she there?
Madam, she left for an emergency
no
call.
issue. So anybody else can have a question, no issue.
Tumkur Society, Dr. Shailaja is there. Shailaja, if you don't have her question, I can give it to you and sir will answer that. What are the forms to be filled and the provisions of personal privacy of the lady under this act? That was Dr. Jyoti's question from Tumkur Society.
So as far as forms are concerned, we have to go for Form C, that is consent of patient. And one more consent also we will have to go, that is informed consent. Because in that Form C only written, I give my permission of termination of pregnancy. So as such, as far as informed consent is concerned, which we take in other surgery or procedure also, so we have to go with two consent, one in Form C and one in informed consent. So that is Form C. We have to form opinion. If pregnancy is less than 20 weeks, then in Form 1, which is again prescribed form as per MTP Act, and we have to form opinion in that Form 1 by one registered medical practitioner. If it is more than 20 weeks and less than 24 weeks, then we have to form opinion in Form E. This is again prescribed form as per MTP Act, and we have to go with opinion of two registered medical practitioners. So these are some forms. Form A is at the time of applying for registration. That Form A we have to fill. Form B, when we are given certificate of registration, then that certificate is considered as a Form B as per MTP Act. So, and Form C, just I mentioned form of consent. Form 1 is opinion. Form 2 is monthly reporting. When at the end of monthly report to CDMO, then we have to go with Form 2. And Form 3 is MTP register, or we can call it admission register also. So that is Form 3 in eye of MTP Act. So all the columns we have to fill in Form Form 3, and number given to that very patient. In that MTP register, we have to mention number only in all other correspondence. Say, for example, if it is a surgical termination, in OT register, we will not go with name. We will go with that number which is given in MTP register. So all other correspondence, even in discharge card also, you will mention only number. So this is to be kept in mind, not to breach confidentiality of patient. And it is serious matter with this amendment. Previously, it was there, but now with this amendment, there is a provision of imprisonment for 1 year, and one cannot afford to have 1 year imprisonment merely on ground of breach of confidentiality of patient. So we have to observe confidentiality of patient. Yes, next.
Thank you. Thank you, sir. That was revision of Dr. Usha's talk on the maintaining the documents. Now, Dr. Shailaja, she is the secretary of Tumkur. Over to you, Dr. Shailaja.
Good evening, sir. Good evening,
Yes,
ma'am.
welcome. Welcome.
My question is, how are you, sir?
Yes, fine. Thank you.
Thank you, sir. Sir, my question is, who can be shown the documents of the lady? Who is the actual authority on whose orders we take out the papers from the MRD?
Yes. There are only 2 conditions where that register, which we call MTP register or from Form 3 or admission, can be opened. One, when patient is working woman, and if she asks for certificate to grant leave, then we can open that register and we can have all the information of patient and we can give her a certificate for leave. But at the same time, we will write one more letter to employer whom she is going to give this certificate, that this is confidential information of patient and you are requested to keep it confidential. But one more thing, we are giving this certificate to patient. We are not disclosing to any other person. So if patient is willing to give it to anybody, that is up to patient. So this is one condition. And one more condition, under authority of law, person who is authorized to inspect that register can be open and information can be shared. So in this situation, it depends upon the different district and different state. So in Gujarat, Chief District Medical Officer is appropriate authority for MTP Act. And that very officer can visit your hospital, can inspect register, and can open that register also. One more area, if there is a litigation, if it is a criminal case, then investigating officer is conferred with power by law. So that very person can also inspect your register.
Sure, sir. Sir, just one more question.
Yes.
Sir, as you mentioned, the lady might want us to give a medical certificate stating she needs bed rest for so and so many days. Each company has its own policies for abortions. Many government institutions stick to 45 days, but certain private institutions, they give maximum of 10-15 days. Is there any fixed law regarding?
No. This is not our job. We have to advise rest as per standard medical norms. Law doesn't teach you medicine. We have to treat patient according to medical norms. If rest of 7 days required, you will simply write rest for 7 days required. If 45 days, 45 days. And this is interpretation on part of employer. If you have prescribed 45 days and in their company, they are giving only 10 days or 15 days, that is their headache. You have to advise as per medical norms.
Sir, that means
So it's usually 7 to 10.
MC Patel, sir.
Yes.
Actually, for spontaneous miscarriage, up to 45 days provision is there.
Yes.
But as far as MTP is concerned, only 2 weeks is advised.
Yes. That is why as per standard medical norms.
As per the government rules. But we don't know how private people will be. It is up to them. But this is a government rule.
If there is government circular and if it is specifically mentioned that in this situation, this much days rest can be allowed, then we can prescribe that. Or we can write advise rest as per standard government rules and regulation. This is also one way to prescribe.
That is a fantastic statement.
Yeah.
I always write like that because we don't know how much is what. To keep ourselves safe, this is what we write.
Yes.
Yes.
Manpreet was asking. Yes.
As I was asking, now in this certificate, we can clearly mention patient has undergone MTP and requires rest for so many days.
Yes, very well. Because we are handing over that certificate to patient. So till then, we are not disclosing confidentiality of patient. If patient gives that certificate to anybody, that is up to patient. We have not disclosed.
So the same thing applies to the OPD slips also. If she has come for termination, we will write wants MTP.
But up to OPD level or so, still you have not terminated pregnancy. Still you have not entered all the entry in MTP register, or that is form 3. Till then it is open. But after you enter all the information in form 3 and when you terminate pregnancy, all correspondence will go with number which is given in register.
Okay. Thank you.
Sir, where does this confidentiality stop? Like, is it only to her, or can we inform husband or mother-in-law, etc.?
We cannot inform anybody.
Including husband.
When she is major, when she is mentally sound, then we cannot disclose her confidentiality without her permission to anybody,
Right.
not even her husband.
All right. Fine.
So about the informed consent, what we take, it is just the patient, or should we take the consent from the like attender's husband or anyone?
No,
like sometimes it is consent.
I mentioned prior also, when patient is adult and mentally sound, only and only patient will sign the document. If she is minor, then only guardian will sign. Or if she is mentally challenged, then guardian will sign.
Okay. Over to Dr. Pooja again. She's the assistant professor of obstetrics gynecology in JIMS, Gulbarga. Dr. Pooja, you can ask your question now.
As per again, I'll be talking about confidentiality only, ma'am. Like confidentiality is strictly maintained was a recent amendment. In this context, we say like when we are submitting the form to the district authority, we online submission. How is the privacy maintained? And extending this question, when I'm maintaining the confidentiality and privacy, while giving the documentation to the patient, sir has already mentioned, I suppose it's a admission number I have to give it to the discharge card, right, sir?
Yes.
Sir, but if I am giving it to the any firms or anything like where she is working, should I again mention the number or the name of the patient with all and another letter or anything like that?
Whatever papers you are giving to the patient, till then you have not disclosed any confidentiality to anybody. If patient is willing to give that to anybody, then that is up to patient. But you cannot disclose. Say for example, if she is covered with some insurance company, and insurance company people comes to you that I want papers of treatment given to that very patient, you cannot give paper to that fellow without permission of your patient. So here it is a breach of confidentiality.
So one more question, sir. Today I attended a POXO case where I'm working in a government institution.
Yes.
I saw a case of a rape, and then it was like proved she was a pregnant lady, and she was around, young girls, 15 years.
Less than 18.
Pregnancy was there, 20 weeks, scan reports were there. And then RFSL report also said like some anal stains were present in one of the article. And I was very much sure that I will be like giving the report. And the question asked by the lawyer was, did you collect any of the information, like document of the patient, telling that the patient who has come to you is same lady, like XYZ has come to me, I have examined her. And at that time, I could only say the police has come to us and we have examined a case, and I have given a report based on whatever the patient was brought to me for examination. But they made it mandatory for me, telling that if a young girl comes to me, even though I have written identification marks, I have mentioned all the things, still the question was from the defense lawyer telling that you didn't collect any of the documentation. Hence, how will you tell that the patient, patient whom you have examined is the same lady? So at that time I could not.
Yes.
Did you collect the Aadhaar card?
One more thing. We are going to discuss totally on POXO Act in our next webinar on 22nd. 22nd. And yeah. it is with some Sikh Society of Kasoga only. So I will request to attend, of you please attend that webinar. We are exclusively discussing POXO Act. But
since it was
just to summarize in very brief, you have to go for Aadhaar card, and if she has given you Aadhaar card, then you can identify this is she is the same lady. If
normally when they get
and it
the
is
police
to be attested by that very person who has produced this Aadhaar card. If she is minor, then that very Aadhaar card will be attested by person who is with her and who is major and mentally sound. So if they have attested that Aadhaar card, then you are safe.
Yes.
You can go with identification mark, etc. This is abundant caution, but Aadhaar card is good evidence. Or you can go with school living certificate, election card. So wherever information can be availed as far as that very patient is concerned, you can have ID card.
As a practitioner, we would be thinking if a case is brought by police, everything will be maintained, and it is like our work is to do a medical examination. In this, the take-home message for me was like, whoever comes to me for treatment also, like for especially with the section, I mean MLC cases.
No. We are not, we cannot be pardoned with this, because as for any patient comes to us, we start with history. What is the complaint? Then we go with past history, family history. We inquire everything, and then general examinations, systemic examination, specific examination, or we offer some investigation, and then we come to diagnosis. Same way in POXO case, whenever patient is brought to you either by police or by relative, then we have to go very methodically. So inquire about age, take consent of patient if patient is more than 12 years, and in lower than 12 years, then consent of guardian, and examine thoroughly with all any stains, blood stains or cement stains or any other, and collect garments, etc. These are the evidences. And then you have to go for prophylaxis of HIV also, because we never know if it is a case of sexual assault or rape. So this is also, we are supposed to offer this HIV prophylaxis also. And at the end, you have to form opinion that whether she is victim of sexual assault or whether she is being victimized for sexual assault for a longer period. So you have to opine. And whenever you are asked to be in court of law, you have to justify all this, your opinion, with your records and all this information you have collected.
Thank you, sir. Thank you.
Are you clear, Dr.
But you attend next webinar on 22nd.
Yes, sir. Sure, sir.
Yeah, it's exclusively on POXO Act.
Yes.
Fine. Okay, Dr. Sanjana Tallur, you can come up with your question. Dr. Sanjana is the past secretary of Gulbarga Obstetrics Gynec Society. Dr. Sanjana, please.
Is she there?
Ma'am, I think she also left due to an emergency.
No issue.
Yeah. With OTC availability of MTP pills, where does the reporting on MTP stand?
Then we have discussed with the question of Mudnar, sir.
Exactly.
We have taken this question.
Yeah, we have discussed this question. And next is Dr. Jayashree. Dr. Jayashree is the past secretary of Gulbarga Obstetrics Gynecology Society. Over to you, madam.
Yes, Jayashree, madam.
Dr. Jayashree?
Is she there, or you can pass on?
She is not there, sir. She is not there.
Lethal deformity detected in anomaly scan at 23 weeks, scan MTP done. Probably it's completed.
Yes.
We have covered that.
Up to 24 weeks of pregnancy, when it is more than 20 weeks and less than 24 weeks, you can very well terminate pregnancy with opinion of 2 registered medical practitioners if it is a congenital fetal anomaly incompatible with life of fetus.
Next, we turn to Dr. Uma C.K. Madam is the past secretary of Mandya Obstetrics Gynec Society. Dr. Uma, please.
Hello.
Yeah, yes, madam. Please proceed.
Sir, good evening, sir. Sir, my question to you, sir. Non-lethal anomaly detected at 27 weeks. Can MTP be done? Under which provision? What is the legal procedure involved?
Only 1 minute. I was busy with a call.
Hello.
Call from Arjun because he couldn't get this link. So, can anybody send faculty link to Arjun? Arjun from Mandya. Rekha? Hello.
Hello.
I will send.
Okay, you send it and we will proceed accordingly. What was the question?
Non-lethal anomaly detected at 27 weeks. Can MTP be done?
No.
Under which provision?
Non-lethal anomaly and pregnancy is more than 24 weeks. So even it is lethal anomaly, then also we have to go for opinion of medical board. But in non-lethal anomaly, we can go with the opinion of medical board. If medical board opines, fine. Otherwise, we have to seek permission from honorable court with writ petition. Otherwise, we cannot terminate.
Provision. What is the legal procedure involved?
So, if we have to move to Honorable High Court with writ petition, then advocate will prepare writ petition and it will be filed before Honorable Court. And after hearing both the party, court whether to permit, whether not to permit, it is up to the discretion of court.
Okay, sir.
Sir, we will have to go on behalf of the party to the court.
No. Patient and patient party will go. We have not to go.
So only the lawyer.
Patient should come to us with permission of court, then we can terminate. Otherwise, it is not our job to ask for permission on behalf of patient.
So, sir, how to convince the court? Whether the doctor should go to convince the court
No. If patient and patient party has filed a writ petition, if court is of opinion that court requires opinion from doctor, then they will refer that case to medical board, not individual doctor. And if medical board is of opinion, then court will give permission.
Okay. Thank you. Sorry for the interruption.
Yes. Next.
Sir, one more question, sir, from me.
Yes.
Sir, over the counter, this MTP pill is sold, no, sir? To the district hospital or to the Taluka hospital, patients will come with the history that she has, some doctor has prescribed, medical practitioner or government doctor has prescribed these drugs. I have taken. Now I have got lot of bleeding like that, incomplete abortions or hypovolemic shock. What we should do, sir?
So in this type of, this is a complication. So it doesn't come in purview of MTP Act. Incomplete abortion, missed abortion, blighted ovum, all these are complication of pregnancy. So you can treat patient accordingly. No need to go for Form C, Form 1, and no entry in MTP register also. This is not case of MTP.
They mentioned that she has taken MTP pill over the counter.
But it is history given by patient that she has taken MTP pill from medical store. But you have to treat as a complication of pregnancy, and it doesn't come in purview of MTP Act. And it was clarified in RTI, which happened in 2012. All these questions were asked, that if it is a case of blighted ovum, incomplete abortion, missed abortion, does it come in purview of MTP Act? Answer was no. And one more question was asked, should we go with Form 1, Form C, or should we enter in MTP register? And answer was no. So this is very clear. So it is not purview of MTP Act.
Dr. Uma, she has come to you with the diagnosis of incomplete abortion.
No, she mentioned that she was bleeding.
Yeah, further on you have to take care. That was diagnosis.
Following MTP pill.
Agree.
Yes, next.
Yeah. Okay. I move on to Dr. Indra Vivek. Thank you, Dr. Uma. I move on to Dr. Indra Vivek. Dr. Indra is the past secretary of Tumkur Obstetrics Gynecology Society. Dr. Indra, you can please proceed with your question.
Namaskaram, sir.
Namaskar.
So my question is, if the lady is a major, she can she alone give the consent for MTP, or the consent of the husband is also required?
Not at all required.
And is the consent?
If she is major, if she is mentally sound, she can give consent for her pregnancy to be terminated, and no need to go for consent of anybody.
And only Form C to be filled, or an extra consent should be taken in form?
Yes, Form C is to be signed by patient, but informed consent should also be signed, because in Form C, just I mentioned prior also, it is only mentioned that I give permission of termination of my pregnancy. So it is not informed consent. So as far as informed consent is concerned, we will have to go with informed consent. And at the end of this webinar, I mean this discussion, I will discuss about uniform consent on part of FOXI. In that very consent, we have prepared consent for medical termination of pregnancy, medical method and surgical method. We will discuss at the end.
So I have one more question.
Yes.
Recently, I had a situation where I had seen the patient in the year 2022, and she had come with 5 weeks of gestation. And 10 days later, she had bleeding per vagina. She came with bleeding per vagina history of 3 days. Then recently, she has filed a complaint against her husband because of the mental agony caused by her husband. She has aborted and she has taken treatment from me. And the police has come with a requisition about the treatment done during that time, which I do not have any records of.
So,
I just have the OPD records is with the patient. OPD, just the number and the phone number and the name of the patient with gestational age diagnosis is written.
Did you treat
Nothing
that
else
patient,
is written other than
did you treat that patient as an OPD patient or indoor patient?
OPD.
OPD
patient, sir. OPD.
So from OPD paper, you can opine, and in that OPD paper, just we go with any other patient with history. Did she give history of assault by her husband?
No, sir, no.
And did you mention?
No, sir, I do not have that records. The OPD patient record is with the patient, and she's not.
You can ask those records through court from patient.
Okay. Because we asked her several times, but she told she'll take the consent of her lawyer and then only give it.
Okay. So you have not to worry till they submit all the records. You can very well tell in the court that when all this record will be available with me, I will be giving my expert opinion. So I keep my right reserved to opine about this case. That way you can very well mention in court.
So one more thing.
Without any record, how one can recollect any patient treated 1 year or so?
1 year back.
It is very difficult, and court also understand that.
So one more thing, can we write on the OPD sheet as no MLC for all cases and take a signature?
It doesn't give you any immunity. Any paper is a document. Your OPD paper, your prescription, any paper is document, and it can be used as a legal document in case of MLC.
That's what, sir. If I write for every case who comes
it doesn't give you any immunity.
Sir, actually, I also had similar situation. A patient who was treated for MTP, after 1 year, I had to give all the details. She was treated on OPD basis. So from then I started keeping even the OPD Xerox copy.
As such, if you have treated any
patient
patient for termination of pregnancy with medical method on OPD base, then also paper of patient is to be preserved. And we have to preserve all those records for 5 years.
I'm doing that now, sir.
As per MTP Act, you are supposed to preserve all the records for 5 years.
So one more question.
Yes.
A couple comes telling that they have got registered marriage, but they do not get any document with them, and none of the parents accompany with them because none of the parents know that they're married. They're going to marry after 2 years from now. And she's pregnant by 12 weeks and they want termination of pregnancy. So
marital status has no place in MTP Act. Age matters. If she is major, irrespective of her marital status, she can go for termination of pregnancy. She can sign consent form. If she is less than 18, you have to inform police. Simple.
So if the patient is less than 18, unmarried, but she comes with incomplete abortion, even then we have to inform the police.
Yes. Because it becomes a case of sexual assault. It is proved with her pregnancy. So you have to inform police. And this type of very interesting situation we are going to discuss next week. So you attend that webinar on 22nd.
Dr. Shobha,
Yes,
it is
yes, next.
it is the age at the sexual act that is more important than
Age
the
matters.
pregnancy diagnosis.
Age matters.
Yes.
Yes.
Okay.
Sir, in these days in Chhattisgarh, they have made reporting of even incomplete abortions, evacuations done mandatory. So whatever is the state in Karnataka, they will have to know. Their CMHO will be sending them letters that you need to report this and report
So
this.
if it is circular on part of government, then we have to comply with them.
That is what, because it is different. Previously, we only had to report on the live MTPs that were done. Now they are saying that even if it is an incomplete abortion, missed abortion, whatever, you have to report it.
Yes, that.
Thank you, Dr. Indra. Last two panelists we have, Dr. Manpreet Kaur. Dr. Manpreet is the past secretary of Bijapur Obstetrics Gynec Society. Dr. Manpreet, please go ahead with your question to sir.
Manpreet has asked so many questions prior also. Welcome. Welcome, Manpreet.
Permits, that is my question is, if time permits, sir.
Yes,
Can
yes.
you have some interesting cases which can, teach us how to avoid some litigation problems which can be common in the MTP Act?
So we will discuss at the end when I discuss this informed consent.
That's all. No, sir, one more question. I think Dr. Bellad would also like to now talk on this, sir. My one confusion till now is, for India, still, what is an abortion? Is it 20 weeks? It is 24. Is it 26? Is it 28?
24.
So in this legal point of view, if you can say age of viability.
So we used to call it 28.
So before age of viability, it is abortion. And
Yes, sir.
after age of viability, it is preterm delivery.
I understand, sir. But now the confusion is that whether India is still sticking to 28 weeks or have we come back to 26, because no standard document says that we have come to 26. The foreign books write that abruptio, which we say is after the age of viability, they are defining it as 20 weeks and above. So it's really confusing when, we have to teach our students that an abortion is less than so many weeks. Till now, we were sticking to 500 grams and 28 weeks.
Yes. So when there is a gray area, then
Yes,
we have to go with our medical textbook also. So in our medical textbook, whichever is written is considered in court of law.
Sir, I just want to answer to Manpreet.
Yes,
question.
yes.
Manpreet, I was, see, the very important thing is the viability worldwide. The WHO also has changed, and India is in consultation with the WHO. It is there. Earlier, we used to teach as 28 weeks, but today viability is considered at 20 weeks or 500 grams, whichever is there. It's 500 grams is not at 28 weeks. 1,000 grams is at 28 weeks. Baby weight. So 500 and above, as for the labor is concerned. But whereas as per the MTP Act, they have little considered up till 24 weeks with two doctors' opinion, which was earlier up to 20, has gone to 24 weeks. And this is very clear. And wherein, you have even the non-lethal anomalies are also there. They can be terminated because you need to take two opinions of your colleague, one more colleague of yours, and you feel that it can be terminated, you can terminate and say that it is a medical termination of pregnancy. You are not defining whether it's the preterm labor or abortion. That's the point is very, very clear. But beyond 24 weeks, termination of pregnancy medically is after the medical board permission.
Yes.
No,
That's
sir,
all it is what is there. This is a very clear message. This is a clear message. But I had a question to Dr. MC Patel.
Yes.
Yeah. See, you are telling all along that the only patient's consent is enough. And there is no, see, you are doing an MTP. Patient has a perforation, she goes into shock. If the patient from the nursing home, the doctor wants to refer somewhere, who has to take this case? See, that is why any surgery when we are doing, any surgical procedure when we are doing, So there has to be some attender who has to be informed about this. And the risks, we explain, this is a procedure. And this, if that happens, what are we going to do? Are we taking the patient to the referral hospital? No. So
Can
there is,
So,
one second.
So,
Let
Dr.
me
Billard,
complete.
there are two situations. If patient is for medical method of termination, then even if no attendance, it will do. But whenever we are going for surgical intervention, of course, consent will be given by patient only when patient is major and mentally sound. But just you mentioned, it may end up into perforation also, or sometime blood transfusion may be required. Because in one of the cases, the same situation happened, and doctor informed relative. Relative came, blood was arranged, patient was saved, laparotomy was done. But allegation on part of family members was where that why you didn't inform us prior. So in this situation, whenever you are dealing with a surgical intervention with permission of patient, because if patient doesn't want to disclose her confidentiality, it will be difficult for us also in that very situation. But we will have to explain. It is surgical intervention, and that is why one responsible person should be with you. And if she is convinced, if she signs the document that I have given permission to Mr. or Mrs. So-and-so to be with me, then we are safe all the way. Patient cannot say that it was breach of confidentiality, and we are also safe.
Sir, however you word it, but there has to be some responsible person with them.
Yes,
and that also proves one more thing is even I am telling there, even if the person opts for a medical termination in your OPD, it is better that we have documented proofs that her IDs are there, and there has to be, see, if we want to safeguard ourselves, there have to be some additional procedures we should take, which I do personally, Dr. Patel, whether the legal requirement is there or no, but we have to safeguard ourselves.
Yes,
even in OPD, with because see, there is on one ground, husband can even divorce the woman if the MTP is done without his knowledge. So that time we will be asked whether the MTP is done or no. Court through it comes. So it is better that somebody is there with them, and so that we are safeguarded. Law may say that it is a woman's consent is enough, but we need to have additional protection and see that somebody is there with the patient when we are doing surgical MTP. That's what my opinion I wanted from your opinion also.
I will discuss that point also when I will discuss about this uniform consent.
Sir, once we had a situation like that where the patient did not want to get anybody, so we had, because as Bellat sir said, we wanted somebody outside the OT in case of a complication. So she called her brother, but she told us that please don't tell him that I'm undergoing an MTP. So what we told the brother is, it's a gynec procedure. You can talk to the patient later. Right now we need you outside. You please be there in case there is a complication. We might need you. So we did not reveal to the relative what it was, but we had out.
And if at all relative ask anything, then we will say that we have explained everything to the patient. You ask to patient.
Yes, sir. Yes, that's what we told her. After she comes out of the OT, you can ask her. And but we had that security that there is.
Yes, exactly.
Sir, one more situation in similar to what Manpreet told. One of the doctors did like this. Somebody came as the attender. And then later on that person disappeared when there was a problem. Patient developed sepsis, and then the parents came and caught hold of the collar of the doctor. Why did you do without our permission? And see, this doctor, of course the consent, everything was done, but they had not taken that attender who was there. His Aadhaar card was not with them, so they could not trace that person. But doctor was unnecessarily harassed. Of course, nothing happened to him.
Legally, you cannot be challenged, but socially, this type of incidents may happen. So, just mentioned by that person who attended with that very patient, you should have all the information of that fellow also. Yes, next, Rekha.
Okay. Yes, sir. There is the last panelist, Dr. Kavita Banwal, and she is the secretary of Bhagalpur OB-Gynec Society. Dr. Kavita, you can talk to sir.
Is she there? Or Arjun has joined. So Arjun has
Dr.
to ask.
Kavita, yeah, Dr. Arjun.
Arjun, please unmute. You are muted.
Yeah, madam,
Yes,
good
welcome.
evening. Sir, good evening, sir.
Good evening. Welcome.
Sir, for the confirmation of age, what certificate is needed, sir?
So for confirmation of age, one important question was asked in one of the court, who is responsible to determine age? So court has very specifically mentioned, doctor is responsible to determine the age. So whenever you are in a little dilemma, you can ask any proof which mention age. Say for example, school leaving certificate, Aadhaar card, election card, driving license. Even if you have doubt, all this, our patient is not ready to produce any of the document, then you can go with dental examination, radiological examination, and you can subject patient for forensic department to determine age. These are the provisions in law.
Sir, in Aadhaar card, no different, sir. In school certificate is different, sir. That's why.
So if it is there, whenever patient produce any document, I mentioned prior also that it should be attested by that very patient. Say for example, you have taken Aadhaar card, Xerox copy, patient will sign. It is attested by. Otherwise, if at all it is a fake one, then you are out of problem because it becomes a case of forgery on part of that very patient, representing false document to you. You are safe.
Thank you, sir.
Yes.
Thank you. Thank you, sir.
Sir, Dr. Kavita's question was, what is your final minimum recommendation?
Kavita is there. Kavita?
I called
Yes, sir,
Yes.
I'm here. Thank you, sir.
Yes.
Actually, I have to go for emergency cesarean.
No,
but
no
okay.
issue. No issue.
So, yeah. So, sir, yeah, I'm asking you. Yeah. So, sir, this is question for you. What should be final minimum recommendation to avoid litigation in MPP? So, till now, we have heard all the things, all the litigations and how we will handle. So, this is the last question.
I will cover in my last presentation. Only give me 1 minute to share my screen.
Sir, there is one more question.
Yes, you can ask.
What,
You can ask.
sir, what if the husband argues that it was his baby? So his consent too should have been taken.
No, in MTP Act it is very specifically mentioned when patient is major, when patient is mentally sound, only and only patient has to sign. No need of husband consent or husband's permission.
Okay,
No need.
okay, thank you, sir. Okay.
So is my screen seen full?
Yeah, it's visible, sir.
Full screen.
Yes, sir. Full
So,
screen, yes.
greetings from Statue of Unity, tallest statue of world. Warm welcome all the delegates who have still joined this. Thank you all the societies who have joined this webinar. And this is my small request video, only 1 minute. Respected seniors and dear colleagues, serving Foxy for years together on this auspicious day with folded hands and down head, I seek your guidance, blessings and support to endorse my candidature for the post of Foxy President year 2026, election year 2024. Consistently working for Foxy and trying to visit even a smaller society and to assist our common Foxian friends in any given situation, I have tried to serve Foxy. I assure to serve Foxy in the same way with the same G and enthusiasm. पथ का अंतिम लक्ष्य नहीं, सिंहासन चढ़ते जाना, लिए सभी को साथ, आगे है बढ़ते जाना.
Thank you, sir. Thank you. So nice video. Thank you. So we all need your blessings too, and all the best.
So it is my humble request to endorse my candidature for
Yes,
post
sir.
of President Foxy election year 2024. So
Yes, sir.
let us see Foxy uniform consent. We three medical legal experts, Dr. Dilip Walke from Pune, Dr. Nikhil Datar from Mumbai, and myself, Dr. MC Patel, we have prepared 30 different consent, and now it is available in Kannada also. So In that very concern, we have to discuss pertaining to our today's topic, medical termination of pregnancy, medical method, how we have prepared that informed consent. So name of procedure, we will have to write medical termination of pregnancy. Meaning, what is the meaning of medical termination of pregnancy? Purpose or indication, all the indication which we discussed during our panel discussion, we have mentioned. You have to simply mark the indication which is fit in your patient. Description of procedure, how this medical method will work. Benefit of procedure, how this will be benefited to the patient. Alternative, if patient is not ready to go for medical method, then which are the alternative, we have mentioned that also. Consequences of refusal of procedure, if patient is not ready to give consent, then which are the consequences? We have mentioned that also, that it will be continuation of pregnancy. Outline substantial risk. Say, for example, possibility of excessive bleeding, prolonged bleeding, or pain, may need surgical procedure. We have mentioned that also. Possibility of infection, possibility of incomplete evacuation or failure. Every individual has a different way to cope up. We have mentioned that also. And in part 2, it is undertaking. So whichever points we have mentioned in part 1, patient will go in undertaking in part 2, and patient will give all this in undertaking. But very important point I have mentioned, which was worried by Dr. Billard many times, it is this number 4. In order to save life, it may even be necessary to do additional surgery or procedure and prolonged anesthesia, which are beyond the scope of consent given by me. I authorize doctor to take such decision if need be. And one more part we have mentioned. I understand that during course of treatment, doctor may find other unanticipated unhealthy condition that may need specific action, procedure, surgery, and anesthesia. If doctor feels that it will be beneficial to treat such condition, and if I am not mental or physical capacity to give consent, doctor may take necessary decision after discussing with Mr. or Mrs. So-and-so who is waiting outside operation theater. I authorize above mentioned person to give proxy consent on my behalf. So if this type of consent patient has given, then it is not breach of confidentiality, and we are saved in court of law. So we should go like this. So we should go with 2 consent. One consent in Form C, which is prescribed form as per MTP Act, and one informed consent, just I have mentioned. And at the end of consent, signature or thumb impression of patient and signature of doctor is to be mentioned. And to conclude, which was the question of Manpreet or last panelist. So carry home. Center must be registered. Person must be qualified. Opinion, pregnancy up to 20 weeks, 1 registered medical practitioner. Beyond 20 and less than 24 weeks, not less than 2 registered medical practitioner for some special categories which we have discussed. Beyond 24 weeks, in fetal anomalies, medical board's opinion in fetal anomaly which are incompatible with life of fetus. Beyond 24 weeks, rape victim with normal pregnancy, writ petition before Honorable High Court. Valid consent in Form C is mandatory. Necessary record to be sent in prescribed form, that is Form 2, to CDMO in stipulated time. So comply with the law of land. And this gentleman have so many staircases, but he doesn't know how to use them. So it doesn't matter how many resources you have. If you do not know how to use them, they will never be enough. So there are so many provisions in MTP Act in our favor to be safe in our practice, but we should know that. So have some basic legal knowledge and always obtain medical legal advice whenever you are in doubt. So to conclude, if you want to sleep like this, take tender care of your patient, comply with the provisions of MTP Act, pray your Almighty God before going to sleep, and keep my visiting card below your pillow. And this is law of leopard behind innocent gynecologist, and see the role of medical legal counselor, how he can be useful in any given situation. So please do not hesitate. Please ask any query, any question at any given situation. We are always there to guide you, help you. So all the best for safe practice. And again, all the best to me also to endorse my candidature for President Foxy election 2024. God bless you. Have a litigation-free medical practice. With regards, salute to all. Thank you very much. Please do not assume. Please ask if any query, if organizers and time permits. Thank you very much. I think.
Thank you, sir.
Query on part of Arjun is solved. Arjun?
Arjun is not there, I think.
He is there.
He's there.
Sir, tell me. Sir, repeat, sir.
So you had some query. I think I have covered in my talk this.
Yes, sir. Yes, sir. I got it, sir.
Yes.
Thank you, sir.
Okay.
Thank you, sir. Good night.
Good night.
Thank you very much, sir, and wish you all the best. I'm sure you will come as Foxy
And
president.
wish you all the contestants to have flying colors as far as result of this committee chairperson election is concerned. And we are eager to see you all working on different level at Foxy. So thank you very much. On behalf
Thank you, sir.
Happy Learning
Hello.
Masterclass family, we are thankful to all the participants, all the guests, faculty, delegates, and panelists. And one more important question. This was just like MD examination, where the examiner and I was the only poor student. So am I passed?
Sir, distinction,
Yeah,
sir.
yeah,
Distinction.
distinction.
21 question.
Dr. MC Patel, Dr.
Distinction.
Bellar here.
Yes.
Wish you all the best for
Thank you.
your presidential election.
Thank
And everyone is behind you. Don't be well organized and have a communication to all the societies. How the Dr. Sunita Tandulwadkar did, sir.
Yes,
I
yes.
think you need to associate with every state.
Yes.
We are all with you. All the best for you. And from Karnataka also, we assure you. The Bharti is there. Who is
Yes,
going
sir.
to be
Such, I have visited more than 100 society physically, even before this election.
Sure.
And I am
No,
in
no,
touch
you
of all the
deserve it,
society
but-
and all the common Foxian friends. So,
Yeah.
and considering my seniority, sincerity, dedication,
Yes,
and
sir.
readiness to be helpful to any Foxian friend, I should, I mean, I can hope support from all of you.
Yeah.
Definitely, sir. Definitely, sir.
For the preparedness of and commitment of sir, just to tell you that for 22nd program, we have already completed all the work and we are
Yes.
and we have almost done the 29th, that is the next program work also. So as soon as this is over, sir will be ready within 2 days for the next program.
Yes.
2 o'clock in the midnight also, sir will be sending us messages. Sending us message.
but
Give it
all
fast.
All the medical legal counselor who are working in this field, they are kind enough to solve your query even at middle of the night. No issue.
Yes, sir.
Because we consider at 2 a.m. anybody calls me, then naturally he will be in trouble.
It's an emergency.
Otherwise, why he will call me at 2 a.m.? So I am quite patient at that time. I listen carefully and I advise accordingly what to do and particularly what not to do.
Yes.
This is very much important. So we are always there to guide our all Foxian friends.
Yeah.
So nobody
Dr.
should
Rekha, can I just have a 30-second?
Oh, yes.
Yeah, with permission of
Well,
Dr. Patel, sir.
Yes, sir. So a very good pranam to Dr. MC Patel first and all our senior colleagues here. And I just want to tell all my fellow Kasogians and Foxians here, received the kindly make fit and vote. Your vote is very, very precious. We want almost at least 90%, 100% votes should come. I request all my fellow Kasogians that if you have not received a link, please contact us. We will try to get you the link because there may be some error in your phone number registration or email ID. And I, Dr. Bharti Rajshekar, am contesting for the non-communicable diseases. Your own Kasogian, I'm going to be president-elect. I request all of you to please do not forget to vote for us. Thank you very much. Thanks, Rekha and Dr. MC Patel for giving me 30 seconds.
Dr. Bharti, just tell that only the presidents and secretaries are eligible to vote.
Yes.
Yeah, I have put that message. Yeah, the president and secretary. If the society has less than 100 members, only the president will get the link. If they have more than 100 members, the president and secretary, so each society will have 2 links. 2 votes if they have more than 100 and 1 vote if they have less than 100 members. So each vote is very, very valuable for us.
Yes. But for me, all are the voters. So irrespective
Yes, sir.
of the president,
All three,
secretary,
3,000.
any member, A category member and B1 category member are voters.
All
Karnataka, we have
all
3,400 votes, sir.
300.
Yes. Yes.
So for
all the best by the time it comes,
maybe before March. Before March.
Yes.
all custodians, all Foxians for sir.
Yes.
Exactly. So we should conclude then.
Yes, sir. Thank you, sir. Thank you, sir.
Nilesh, is Nilesh there?
Yes, sir.
Yes, we can.
Yes, sir.
So you can have a word of, on behalf of Corona, you can have a word and we can conclude. Because we are thankful
Okay,
to
sir.
Corona.
So
also.
we have successfully, thank you so much. So we have successfully concluded 158th edition of our Happy Learning Masterclass webinar series, and looking forward if you more such a beautiful webinar series. And on behalf of Corona team, I thank you all faculty members and delegates who have spared their valuable time in this webinar. So thank you so much. Thank you so much.
Yeah. Thank you and good night.
Thank you, Nilesh.
Good night. I'm ending the session.
And all the best to
Thank you.
all my
We
fellow
can conclude.
elections.
Oh, yes.
Good luck to all of us.
Thank you.
Thank you.
Okay. We can conclude. Nilesh.